Every alarm in Trauma Bay 1 erupted simultaneously. The heart monitor shrieked. A man's body was shutting down organ by organ while 3 physicians worked furiously and still losing him. Security had both arms of the quiet ER nurse, dragging her backward toward the door, when she stopped fighting and went completely still. "Let me go," she said, low and precise, "or he will be dead in the next 30 seconds. Nobody moved. She looked at the patient, not at the doctors, not at the men restraining her, and said it again. 25 seconds. The monitor confirmed it before anyone could argue. If this story already has you hooked, you're not alone. Hit that like button, follow along so you don't miss a single part, and drop a comment telling me what city you're watching from. I want to see exactly how far this story travels. Now let's get into it. The city of Hargrove Falls, Tennessee sat at the edge of a river nobody painted pictures of anymore. It was the kind of mid-sized city that appeared on regional maps but not in travel guides. Functional, industrial in patches, with a downtown that had been half renovated twice and abandoned both times. Mercy Cross Medical Center occupied 6 floors on the north end, a sprawling hospital complex that served 3 counties and ran perpetually understaffed, overlit, and just solvent enough to avoid closure. Nora Voss had worked there for 6 years. She arrived at 6:47 on a Tuesday morning, 13 minutes before the start of her shift, wearing the same navy scrubs she always wore and carrying the same stainless steel thermos she'd had since before she ever set foot in this hospital. Her hair was pulled back efficiently. No jewelry. Flat-soled shoes chosen for 12-hour shifts on concrete floors, not for appearances. The badge clipped to her chest read Voss, N. RN, Emergency Department, and the photo on it looked like someone who had been photographed mid-thought, which was accurate, because she had been. The charge nurse at the front desk, Pamela Okafor, glanced up from the overnight report when Nora pushed through the double doors. "You're early." "Traffic was light." "It's always light at this hour." "Then I'm always early." Nora dropped her thermos on the counter and reached for the overnight summary clipboard. "What am I walking into?" 2 admitted, 1 discharged, 4 still in holding. Bay 3 has a drunk who keeps pulling his IV. Bay 6 has a chest pain we're monitoring. Pamela paused. "Oh, and Dr. Halstead is on today." Nora didn't look up from the clipboard. "Okay, I'm telling you." "I heard you, Pamela." Dr. Warren Halstead was the kind of physician who had been excellent once, probably, and had since confused seniority with infallibility. He ran the emergency department the way some men ran small kingdoms, loudly, with visible disdain for dissent, and with an almost artistic ability to take credit for good outcomes and distribute blame for bad ones. He and Nora had what the other staff diplomatically called a dynamic, which meant she corrected him when he was wrong, and he made her professional life incrementally harder each time she did. She had survived worse dynamics than Warren Halstead. She had survived things Warren Halstead didn't have the clearance to know existed. By 9:15, the department had settled into its particular rhythm, the controlled chaos that felt like disorder to visitors but was actually a system, messy and functional in equal measure. Nora had pushed fluids into the chest pain patient, argued the drunken Bay 3 down from pulling his IV by simply sitting next to him and talking for 4 uninterrupted minutes about absolutely nothing, and had flagged a medication dosage on a pediatric patient that the overnight resident had miscalculated. She did not announce the flag. She corrected the chart, notified the attending quietly, and moved on. That was how she operated. Quietly, efficiently, without the performance that some of the newer staff mistook for confidence. At 10:08, the paramedic radio crackled. "Mercy Cross, this is Unit 11. We are inbound with a male, approximately late 30s, found unresponsive adjacent to Keller Street overpass. No visible trauma, no ID. Vitals unstable, BP dropping, pulse irregular, ETA 4 minutes." Nora was already moving before the radio finished transmitting. She pulled a trauma cart to Bay 1, checked the defibrillator charge without being asked, and started laying out IV lines by sequence of likely need. Marcus, the ER tech, watched her from across the bay. "You heard the same radio I did," he said. "They didn't say trauma. They said BP dropping and irregular pulse on a man with no visible injury and no ID." She snapped a saline bag onto the hook. "That's not a cardiac event. That's something else." Could be overdose. Could be. She didn't say what else it could be. She didn't know yet. But something in the specific combination, the location, the presentation, the absence of any external cause, sat in the back of her mind like a word she couldn't quite recall. The paramedics came through the doors at 10:12. The man on the gurney was broad-shouldered, somewhere between 35 and 40, with the kind of physical build that came from years of deliberate conditioning rather than casual exercise. His clothing was civilian, so dark jeans, a gray thermal, unremarkable boots. But the clothing fit wrong, the way clothes fit on a person who usually wore something else. His face was slack, unconscious, but even in that state there was a particular quality to it. Stillness that wasn't peaceful. Stillness that was controlled, or had been, until whatever was happening to him took over. Found him face down near the support column, the paramedic, a woman named Reyes, reported rapidly. No signs of collision, no road rash, nothing. Bystander called it in. When we arrived, he was conscious but confused, deteriorated fast in transport, talk screen pending. Pulse? Nora asked, already pressing 2 fingers to the man's carotid. 44 and dropping, and too slow for cardiac, too specific for overdose. She leaned over him, performing the rapid visual assessment she'd been trained to do so thoroughly that it was no longer conscious thought. It was reflex. Pupils, unequal. Left was sluggish but reactive. Right was barely moving. She checked his hands. No track marks, no bruising. Checked the visible skin at his collar line. Nothing. She was reaching for his wrist when she caught it. A smell, faint, metallic, but oxidized in a very particular way. Not blood, not industrial contamination. Something that registered not in her nursing training but deeper, in a part of her memory she didn't visit. She straightened. I need everyone to hold current protocol. Marcus looked up. What? Don't push epinephrine, don't push anything yet. She moved around to the man's left side and pushed the sleeve of his thermal up to the elbow. Nothing. She checked the inside of his upper arm. There, nearly invisible, a small puncture site, slightly darker at the margin than the surrounding skin. Not a needle track. The spacing and depth were wrong for that. This was a single precise injection, delivered by something narrow and pressurized. She knew exactly what that looked like. Dr. Halstead pushed through the bay curtain at that moment, chart in hand, the expression he wore when he was performing authority for an audience. What have we got? He glanced at the monitor, at the patient, then at Nora. Standard trauma protocol. It's not trauma, she said. He looked at her. The look that said, I wasn't asking you. His BP is at 61/40 and falling, she said. There's a puncture site on the left brachial, single injection, consistent with a pressurized delivery device, not a syringe. The smell, I don't smell anything. I do. She kept her voice level. The odor is consistent with organophosphate breakdown, not nerve gas, something more refined, synthesized. The presentation matches You're a nurse, Halstead said. Not cruelly, exactly. Just with the particular dismissiveness of a man who had been saying that sentence for 20 years. Step away from the patient and let me work. If you push epinephrine into this man right now, his heart will stop. The room went quiet. Not silent. The monitors kept going. The hum of equipment didn't stop. But the human sounds in the room ceased. Are you threatening me? Halstead asked. I'm telling you what will happen. She didn't raise her voice. Epinephrine on a cholinergic toxidrome will accelerate cardiac overstimulation. He'll go into full arrest within 90 seconds, and he will not come back. The protocol for this presentation is atropine and pralidoxim, initiated immediately, followed by... That is not a protocol that exists in this facility. It exists. It's used in... She stopped. She had almost said where it was used. It's documented in military and specialized toxicology literature. I've seen it work. Halstead set the chart down. He turned to Marcus, deliberately, the way you turned away from something to indicate its irrelevance. Get security. It took Marcus 3 seconds to decide. She watched him make the decision. Not because he agreed with Halstead, but because he was 24 years old and didn't know what else to do when a senior physician said a thing with that much certainty. He left the bay. Halstead went to the medication cart. Nora watched his hand move toward the epinephrine. Dr. Halstead. He didn't stop. Warren. She only used his first name when she needed him to actually hear her. Look at his pupils again. Look at the secretion pattern at the corners of his mouth. Look at his muscle fasciculation. His left hand has been twitching since he came in. That's not cardiac. That is not something epinephrine fixes. He drew the medication. The patient's monitor spiked. A brief arrhythmic pattern, then a drop. His oxygen saturation fell to 88. "He's crashing," said Reyes, still in the room, her voice careful. Two security officers arrived in the bay doorway. Behind them, Marcus, looking genuinely sorry. Halstead looked at Nora with something that might have been, in a different version of him, uncertainty, but it curdled into something harder. "Remove her." The first officer put his hand on her left arm. The second moved to her right. She didn't fight it, not yet, because fighting it would look like the wrong thing, and right now the only thing that mattered was the man on the table. "You have approximately 30 seconds, she said, and her voice was completely steady, before his autonomic system collapses past the point where atropine can reverse it. After that, nothing you do in this room will matter." The monitor confirmed her. The pulse rate dropped to 31. Halstead stared at the reading. 20 seconds, she said. The oxygen saturation hit 82. Something shifted in Halstead's face. Not belief, exactly. More like the particular horror of a man who realizes he might be wrong at a moment when being wrong costs a life. "What's the dosage?" he said. Barely audible. "Atropine, 2 milligrams IV push. Repeat every 5 minutes until secretions dry. Pralidoxime, 1 gram in 100 mils, infused over 15 to 30 minutes. And you need to intubate now before the bronchospasm hits." Nobody moved for half a second. Then Halstead said, "Get me 2 of atropine," and the room unlocked. Nora pulled free from the security officers. They let her go, because the energy in the room had shifted, and they were responding to it without quite knowing why. And she was at the medication cart before the order was finished being spoken. She drew the atropine herself, pushed it into the IV port, watched the monitor. 37 seconds later, the pulse rate ticked upward. 41, 44, 48. She exhaled through her nose, quietly, not allowing herself the visible relief yet. "Oxygen sat coming up," Reyes said, her voice carrying something that might have been awe. 52 beats per minute. 55. The man on the table remained unconscious, but the precipitous drop had stopped. The monitor had stopped screaming. The room had the specific quality of a space where catastrophe had been averted by a margin so narrow that nobody was quite ready to acknowledge it yet. Halstead stood at the foot of the gurney. He wasn't looking at the patient. He was looking at the monitor, at the numbers that were slowly, grudgingly stabilizing, and his expression was doing something complicated that Nora had no interest in decoding right now. "Get the pralidoxime running," she said to Marcus, who was already reaching for it. "And Page toxicology. They need to know what we're dealing with." "What are we dealing with?" Marcus asked quietly. She looked at the puncture mark on the patient's arm, at the particular stillness of his unconscious face, at the boots, the clothes, the physical build that spoke of a life lived in controlled conditions. "I don't know," she said. Which was technically true. She didn't know who he was. She didn't know why someone had done this to him, or how he'd ended up at the base of the Keller Street overpass. She didn't know his name, but she knew the compound, or something close enough to it that the knowing had come from the same place, a place she had spent 6 years not thinking about. Halstead finally turned from the monitor. The complicated expression had resolved into something simpler, a man reconstructing his position. "You violated protocol," he said. She didn't respond. "You administered treatment without physician authorization." "You authorized it," she said. "You said, 'Get me 2 of atropine.' That's an order." "That's not what happened. There are 4 other people in this room." She didn't look at them. "But we can discuss documentation later. Right now, he needs the pralidoxime drip confirmed, and someone needs to start the secondary panel, liver enzymes, acetylcholinesterase levels, full metabolic. I will determine the next—" "Dr. Halstead." Her voice didn't rise. It simply stopped carrying any deference at all. "He almost died. He would have died. We can have whatever conversation you need to have, but not while he's still critical." Something in that, the flatness of it, The absence of any attempt to soften it made him stop. He picked up the chart. He began writing. That was, by the standards of Warren Halstead, a form of agreement. Nora turned back to the patient. She checked his pupils again. Still unequal, but the left was slightly more responsive than it had been. The fasciculations in his hand had stopped. The secretion at the corners of his mouth was already reduced. The atropine was working. She let herself have that quietly for exactly 3 seconds. Then she started thinking about the puncture site again, the precision of it, the compound's particular signature. Civilian hospitals didn't see this. Civilian physicians didn't train for it. The protocols she'd used existed in military toxicology manuals, in documentation she'd had to carry a specific clearance level to access, in field guides designed for scenarios that didn't appear in emergency medicine textbooks, because the people writing emergency medicine textbooks didn't have the clearance either. She had carried that clearance. Once. She pushed the thought down. This wasn't the time. The secondary panel came back 40 minutes later, and the acetylcholinesterase level confirmed what she already knew. The enzyme inhibition pattern was consistent with an organophosphate compound, but the specific profile, the rate of inhibition, the secondary metabolite signature, didn't match anything in the standard toxicology database. Marcus showed her the printout without comment. Unusual pattern, the toxicology resident said over the phone, sounding genuinely puzzled. I've never seen this specific inhibition curve before. Is there any history on this patient? Occupational exposure, agricultural? No history, no ID. Nora kept her voice neutral. Document everything exactly as it appears. She hung up. The man was still unconscious in Bay 1, now intubated and stable, the pralidoxime drip running. He would live. That part she was nearly certain of now. But whoever had injected him with a classified organophosphate compound and left him under a bridge in Hargrove Falls, Tennessee, had not done so casually, and whoever that person was, they might not know yet that their work had failed. She was standing at the nursing station, updating her chart notes, when the administrator arrived. Richard Coyle, director of clinical operations, wore a suit in a hospital the way some men wore authority as a costume. He was 50, graying at the temples in a way he'd clearly decided was distinguished, and he appeared in the emergency department when there was something he needed to control. He was accompanied by Halstead. Ms. Voss, he used the title with the particular inflection that indicated he had already made a decision. Mr. Coyle, I've been made aware of the incident in Trauma Bay 1 this morning. Patient is stable, she said. Toxicology confirmed organophosphate poisoning, likely synthetic compound. He'd be dead if... What you did this morning, Coyle said, and now the tone was clear. Constitutes unauthorized treatment, violation of physician authority, and conduct inconsistent with your role as a nursing staff member. He paused. Effective immediately, you are suspended pending investigation. The nursing station had gone quiet. Pamela, at her desk, was very carefully not looking at anything. Nora set her pen down. She had spent 6 years being careful, 6 years staying small. 6 years making sure the work she did was invisible enough that nobody looked too closely at the gap between what she was and what her personnel file said she was. 6 years making the right calls quietly, absorbing the credit being taken by other people, and treating the ER at Mercy Cross Medical Center like the place where she had chosen to disappear. You want to suspend me, she said, for saving his life. For the manner, she said. Okay. She reached for her badge. The room was very still. You understand that if I had done nothing, or if I had allowed standard protocol to proceed, the patient in Bay 1 would have been dead by 10:30 this morning. That's a claim that the toxicology panel is documented, the acetylcholinesterase levels are documented, the treatment response is documented. She held the badge. But go ahead. Coyle held his hand out. She looked at it for a moment. Then she placed the badge in his palm. I'll need my personal items from the locker room, she said. Security will escort you. I know the way. She walked out of the nursing station, past Pamela, who said nothing but whose expression said everything, past the bay where Marcus was checking the pralidoxime drip on a man whose name they still didn't know. She turned the corner toward the locker room. She was not panicking. She was not even particularly surprised. What she was, underneath the steadiness, was calculating. because the compound she'd identified this morning didn't belong in Hargrove Falls, Tennessee. It didn't belong in any civilian context. It had been developed in a program she had worked in, tested in conditions that were never disclosed. And the fact that it was here, in this city, used on a man who looked like what he looked like? Her phone buzzed. Unknown number. She almost let it go. Then something made her answer. The voice on the other end was male, controlled, carrying the specific cadence of someone trained to convey urgency without volume. "This line is not secure," he said. "Do not say your name. Do not say the patient's name. We know what you identified. We know what you used. We are 40 minutes out." She walked into the locker room and let the door close behind her. "Who is this?" "You don't need that yet. What you need to know is that the man in your Bay 1 is someone a great many people want to remain dead, and the people who did this to him are not finished. The compound you identified, you're the only civilian physician-adjacent personnel in the country who would have recognized it." She stood at her locker. Her hands were completely still. "I'm not physician-adjacent," she said. "I'm a nurse." "We know what you are," the voice said. 40 minutes. The call ended. She opened her locker, changed out of her scrubs mechanically, folded them, placed them on the shelf in the particular way she always had. Neat corners, precise stack, and then sat on the bench for exactly 30 seconds with her hands folded in her lap, looking at nothing. 6 years. She had built something here, something small and sustainable, and hers, her shift schedule, her regulars, the particular satisfaction of working a hard case well and not needing anyone to notice. She had built a life that required no explaining, no clearance, no cost beyond the ordinary kind. She had spent 6 years being Nora Voss, ER nurse, and the man in Bay 1 had arrived 40 minutes ago and dismantled all of it simply by being unconscious on her gurney with a classified compound in his bloodstream. She stood up. She retrieved her personal items. She put on her jacket. She walked to the exit, past Coyle's administrative assistant, past the security desk, and out the employee entrance into the pale gray late morning of Hargrove Falls. And then she stopped, because 3 floors above her, the lights in intensive care, where the unconscious man was being transferred, suddenly went dark, all of them, simultaneously. And then the backup emergency lighting came on in red. The red emergency lights bathed the parking lot in a wash of crimson that turned the morning ugly and wrong. And Nora stood at the employee entrance with her jacket half zipped and her bag over one shoulder and looked up at the 3rd floor of Mercy Cross Medical Center and felt something cold settle in her chest that had nothing to do with the November air. The ICU had lost power. Not the whole building. The ER windows were still lit, the lobby visible through the glass doors still bright, the administrative wing on the 2nd floor still glowing with the particular fluorescent indifference of bureaucracy. Just the ICU, isolated, deliberate. The kind of power failure that wasn't a failure at all. She was moving before she'd consciously decided to move. The employee entrance required a badge she no longer had. She walked 10 feet to her left, to the ambulance bay, where the doors were propped open by a supply cart that hadn't been moved yet from the morning's intake. She went through without breaking stride, and the ER staff at the intake desk, a woman named Trish, who'd worked nights for 9 years and had seen everything, looked up with an expression that shifted rapidly from recognition to confusion. "I thought you were—" "Which elevator is on backup power?" Nora asked. 2 and 4, but ICU is on lockdown. They're not letting anyone—" Nora was already at elevator 2. She pressed 3. The doors closed. The elevator hummed upward with the slightly diminished speed of backup power, and she used the 40 seconds of ascent to think through what she knew, which was not much, and what she suspected, which was considerably more. The man in Bay 1, now presumably in the ICU, had been injected with a compound that existed in exactly one context she knew of, a classified development program, compartmentalized, known to fewer than 60 people at its operational peak, and she had been one of those people for 4 years before she stopped being one of those people in a manner she did not think about in any detail, if she could help it. The program had been absorbed, restructured, or terminated. She genuinely didn't know which, because when she left, she had left completely, the kind of departure that came with paperwork and a very specific set of instructions about what she was to do with everything she knew. She had done what they asked. All of it. And then she had come to Hargrove Falls and become Nora Voss, ER nurse, with a personnel file that was accurate in every particular except the 7 years it didn't mention. The elevator opened onto the 3rd floor. The ICU corridor was running on red emergency lighting, which turned the white walls the color of something not sterile. And there were 2 hospital security officers at the nursing station looking considerably less certain than security officers were supposed to look. A nurse she recognized, Delia Marsh, senior ICU staff, 15 years of institutional memory, was standing with her arms crossed and her jaw set, talking rapidly to a man in a dark jacket who was not a doctor and not a hospital administrator, and was not attempting to look like either. He had the ID out before she reached him. Federal. The kind of federal that didn't explain its agency affiliation in hallways. "Ma'am, this floor is restricted." "I know," Nora said. She looked past him at Delia. "Is he stable?" Delia blinked. "They suspended you. Is he stable?" Yes, the drip is running, vitals are holding, but the monitors went down with the power. We're running manual checks. Every 5 minutes, Nora said. Pulse and ox, every 5. Don't let the interval slip." She looked at the federal agent, who was watching her with an expression she recognized as professional assessment, the kind of attention that was calculating rather than curious. "You're early," she said. "Excuse me?" "Someone called me 40 minutes ago, said your people were 40 minutes out." She glanced at her watch. "It's been 22. Something shifted in his face. He was mid-40s, dark-haired, going silver at the temples, with the kind of physical economy that came from long operational habit. No wasted movement, no expressive surplus. He looked at her the way people looked at things that didn't fit the category they'd assigned them to. "You got a call," he said. "I got a call." "From who?" "Unknown number. Male. Trained voice. Not military exactly. More like someone who'd been trained to sound calm under pressure and had been doing it long enough that it became the actual voice." She held his gaze. "Who called me?" He didn't answer immediately. He looked at the security officers, then back at her, then made a small decision that manifested as a fractional shift in his posture. Less blocking, more beside. "Walk with me," he said. They moved down the corridor, away from the nursing station, toward the window at the end of the hall that looked out over the hospital's north parking lot. Below, she could see a dark SUV that hadn't been there when she arrived. Probably a second one around the corner, out of her sight line. "Your name is Nora Voss," he said. It wasn't a question. "That's my name." "How long have you worked here?" 6 years. He was quiet for a moment. "The man in the ICU. You identified the compound. I recognized the presentation. The toxicology panel confirmed the acetylcholinesterase profile." "But you knew before the panel." "Yes." "How?" She looked out the window. A second SUV was pulling into the lot. She'd been right. "That's a longer conversation," she said, "and I'm not sure this is the time or the place to have it. What I can tell you is that the compound used on your patient is not something that appears in civilian toxicology databases. It's not something that any standard emergency physician would have recognized, and if I hadn't been in that bay this morning, the treatment protocol that was about to be administered would have killed him." She paused. "So before we discuss how I know what I know, maybe tell me who he is, because that might tell me how much danger this floor is still in." The agent looked at her for a long moment, the kind of look that was performing a calculation. "His name is Garrett Vane," he said finally. "Deputy Director of Special Operations Coordination, Department of Defense. He's been running a joint task force investigating an intelligence breach, internal. Someone inside the national security apparatus has been moving classified assets for 18 months. Vane's team was 3 days from identifying the primary source." Nora absorbed this without expression. And someone tried to stop that from happening. Someone tried to stop him from happening. The agent, he still hadn't given her a name, and she hadn't asked, glanced down the corridor. "The compound used on him. You said you recognized the presentation. That compound was developed in a program that was officially terminated 4 years ago." "Officially," she said. "Officially." His tone was careful. "The synthesis protocol for that specific agent is supposed to exist in exactly 2 secure locations, both of which are classified at a level that means the number of people with access is very, very small." "How small?" Small enough that the fact that it was used today tells us something specific about where the breach originated. She turned that over. You're saying the compound itself is evidence. The compound is the fingerprint. He said it quietly. And the fact that you identified it, that tells us something too. There it was. She'd known it was coming. She'd known it from the moment she'd recognized the smell in Bay 1, the moment she'd overridden Halstead, the moment she'd pushed the atropine and felt the particular horrible relief of being right about something she'd hoped she was wrong about. I want it on record, she said, that I've spent 6 years doing exactly what I was asked to do. I left cleanly. I didn't take anything. I didn't talk to anyone. I built a life here and I've been living it without incident, and this morning a man came through my trauma bay and I made a call based on what I knew because the alternative was letting him die. I know, the agent said. I'm not sure you do. Ms. Voss? He said it with something that was close to but not quite gentleness. We're not here because you're a problem. We're here because you did something this morning that nobody else in this building could have done, and the people who put Garrett Vane in this hospital don't know yet whether they succeeded. When they find out they didn't, he stopped. They'll come back, she said. They'll come back. The corridor was quiet. Down at the nursing station, Delia was performing a manual vital check, pen moving efficiently on the clipboard. The security officers were talking to each other in low voices. Outside, in the parking lot, 2 more figures had emerged from the second SUV. You need to clear this floor, Nora said. Non-essential personnel, out. Your people go in, but they need to look like hospital staff. Full scrubs, nothing tactical visible. If whoever did this has eyes inside the building, uniformed federal presence in the ICU tells them immediately that Vane survived. The agent looked at her. You're telling me how to do my job. I'm telling you what I do. She said it without apology. Take it or leave it. He took out his phone, made a call, spoke 3 words she didn't catch, put it away. Give me your contact number, he said. You already have it. Your colleague called me 40 minutes ago. For the first time, something crossed his face that might have been discomfort. Nobody on my team called you. The corridor suddenly felt colder than it had a moment ago. Someone called me, she said precisely. 22 minutes ago. Unknown number, trained voice, knew about the patient, knew I'd identified the compound, said you were 40 minutes out. My team was 50 minutes out 22 minutes ago, he said. Nobody called ahead. She looked at him. He looked at her. Neither of them said what that meant, because saying it out loud in a hospital corridor under red emergency lighting with a critically ill federal official 30 feet away was not the place to say it. But they both understood it, and the understanding sat between them like something with weight. Someone else knew. Someone else had called her. Someone who knew about the patient, knew about the compound, knew about Nora Voss, and wanted her to stay in this building. The question was why. She was still turning it over when the door to the stairwell at the far end of the corridor opened, and a man came through it wearing scrubs, and she registered 3 things in rapid sequence. The scrubs were slightly too long, the shoes were not hospital appropriate, and the way he walked was the walk of someone who had decided where they were going before they entered the space. Down, she said. The agent turned. The man in the wrong scrubs had his hand coming up. What happened next took approximately 4 seconds, and Nora processed it in the specific way she processed fast-moving situations, not in real time, but in a kind of high-resolution sequence that her nervous system had learned to generate under conditions of abrupt danger. The agent moved left. She moved right, putting the wall behind her and reducing her profile, and the man in the scrubs, he'd pulled something, she didn't know what yet, fired at the space where the agent had been standing. Not a gun. The sound was wrong. Compressed air, the particular soft report of a pneumatic delivery device, and the dart hit the wall 3 inches from where the agent's shoulder had been. Dart. Not a bullet. They're not trying to kill the agent, she thought. They're trying to incapacitate. The agent had his actual weapon out now, which was a gun, which made the situation considerably more complicated in a hospital corridor with patients behind closed doors. The man in the wrong scrubs had already turned and was going back through the stairwell door. The agent went after him. Nora went to the nursing station. Delia. She put her hands on the counter. I need you to hear me very clearly. Take every patient on this floor who can be moved, move them to the south wing right now. Anyone who can't be moved, close and lock the room. Do not open doors for anyone who isn't in your staff roster. Do you understand?" Delia stared at her. "What is happening? Someone just tried to put a dart in a federal agent in your corridor. What's happening is that—" Nora looked at the two security officers. "You call for backup and get to the stairwell. You stay here with the nursing staff." "You're suspended," one of them said. She looked at him with an expression that communicated efficiently that this was not the relevant variable. He went to the stairwell. She went to room 304. Garrett Vane was exactly as she'd left him in her mental picture. Intubated, the pralidoxime drip running, leads from the portable monitor attached to his chest for the manual readings. He was unconscious, but the preliminary signs were consistent with the stabilization she'd initiated in Bay 1. Color had returned marginally to his face. The fasciculations were gone. His chest rose and fell with the rhythm the ventilator imposed, steady and mechanical. She checked the drip, confirmed the rate, checked the manual pulse reading on the clipboard. Delia had been doing her job. Then she checked the window. 3rd floor, north face, overlooking the parking lot. The SUVs were still there. A 3rd one had arrived. She could see figures moving near the vehicles. More agents, she assumed, or hoped, though the call that had come 22 minutes ago from someone who wasn't on the federal team had made assuming considerably harder. She pulled the privacy curtain across the room's interior window. Her phone buzzed. The same unknown number. She answered without speaking. "You stayed," the voice said. "Someone took a shot at a federal agent with a pneumatic dart in the 3rd floor corridor," she said. "How did you know that was going to happen?" "I didn't. I knew it was likely." A pause. They had a secondary asset in the building, hospital maintenance. He was in position before Vane arrived. Contingency protocol, in case the primary method was identified before completion. "Before completion," she repeated. "Before Vane died, you mean?" "Before the compound ran its course, yes." "Who are you?" "Someone who needed Vane to survive long enough to complete what he started." Another pause. "And who needed someone in that building who knew what to do with him?" The cold thing in her chest was back. "You knew I was here." "I've known for 3 years." She let that sit for a moment. "What's in the intelligence breach?" "The identities of 6 embedded operatives in 4 countries, a classified network architecture that took 11 years to build, and the name of the person inside DoD who's been selling access to it." The voice was careful, measured. Vane was the only person with both the authorization and the evidence chain to take that to a tribunal with teeth. He'd been sequestering his findings off network for the last 60 days. His documentation is encrypted on a device that only he can access. If he dies, the device wipes in 72 hours. The operatives get burned, the network collapses, and the person who sold them is already in the process of disappearing. He said it without drama, which made it worse. "Nora, the people in that building with you right now are not all the same side. The federal response was triggered by a secondary alarm, not by the primary investigative team. There is at minimum one person in that response who is there to ensure the situation resolves in the wrong direction." The door to room 304 opened. The agent from the corridor stepped in. He was breathing slightly faster than before, jacket askew, expression carefully controlled. He looked at Nora, looked at the phone in her hand. "Who are you talking to?" he said. She looked at him, at the careful expression, at the fact that he'd come here first, to this room, to her, rather than to the stairwell where his colleague was presumably still in pursuit. "No one," she said, and ended the call. He looked at Vane, then back at her. "The secondary asset got away. He went sub-basement. We lost him in maintenance." "Your team is sweeping sub-basement?" "2 agents. "Pull them back," she said. "Excuse me?" "Sub-basement in a hospital this size has 17 access points, 2 of which exit directly to the street, and maintenance has a separate HVAC routing system that can move a person from sub-basement to any floor in under 3 minutes if they know the building." She looked at him steadily. "If your asset is still in sub-basement, he's not hiding, he's waiting, and you're sending 2 people into a space he knows better than they do." The agent stared at her. The calculation was back in his face, more visible now, less disguised by the professional neutral. "How do you know the building layout like that?" he said. I've worked here for 6 years. The sub-basement access points. I've had patients brought in through maintenance access during a flood event. She kept her voice flat and informational. I know the building. Pull your people back and seal the exterior exits. If he's still in there, you contain him that way. If he already left, you've lost him, and adding 2 more people to sub-basement doesn't change that. He was quiet for 4 seconds. Then he made another call. She turned back to Vane. His blood pressure on the portable cuff read 91/60. Better. Not good, but considerably better than the 61/40 she'd seen in Bay 1. The atropine was doing what it was supposed to do, and the pralidoxime was working on the enzyme inhibition at the mechanistic level. This would take time, hours rather than minutes, and there would be residual effects, fatigue and cognitive haziness that could last days. But he was not dying. She adjusted the drip rate by a fraction. You shouldn't be in here, the agent said behind her. Probably not, she said, not turning around. But here we are. He moved to the window, stood there, looking out at the parking lot, and she watched his reflection in the darkened glass. The angle of his head, the set of his shoulders. The call you got, he said. Before we arrived, you said it was a trained voice. Yes. Male, calm, knew about the compound. Yes. Did you recognize it? She thought about this, about whether she recognized it, and about what she would be confirming if she said yes, and about the fact that the man on the phone had said that at least one person in the current federal response was not operating in the right direction. No, she said. He nodded slowly. She couldn't tell from the reflection whether he believed her. The ICU corridor outside was now busier. She could see through the interior window, past the curtain's edge, additional personnel arriving. Scrubs, some of them. Others in the dark jackets. The hospital had the feel of a building that was simultaneously trying to function normally and failing at it in a very specific way. Patients still needed things. Equipment still needed checking. The rhythms of clinical care did not pause for federal investigations. And the nursing staff was moving through it all with the particular expression of people performing their jobs under conditions that had not been in the job description. Delia appeared in the doorway. She looked at the agent, then at Nora, then settled on Nora because that was where the relevant information seemed to live. The hospital administrator is here, she said. Coyle. He's asking about you. What about me? Whether you're still in the building. She paused. He seems... She searched for the word. Agitated. Nora looked at the agent. The agent looked at his phone. Who notified administration? He said. I don't know, Delia said. He was just suddenly here. He came up through the south stairwell about 5 minutes ago. The south stairwell. Not the main elevator, not the administrative corridor route, the same stairwell that would be accessible from the sub-basement. Nora looked at the agent and this time did not look away, and did not offer him anything to work with, because the voice on the phone had said there was at least one person in the current situation who was there for the wrong reasons, and Richard Coyle had suspended her 90 minutes ago for saving a man's life. And Richard Coyle had just come up from the south stairwell 5 minutes after a man in wrong-length scrubs had tried to put a dart in a federal agent in the ICU corridor. The agent was running the same arithmetic. She could see it. Tell administration, he said to Delia, very carefully, that the ICU is restricted access by federal authorization, and that all personnel not identified as clinical staff are required to wait in the administrative conference room on the 2nd floor until a briefing can be conducted. Delia absorbed this. And if he doesn't comply, then come back here and tell me. Delia left. The room was quiet except for the ventilator's rhythm and the soft alert tone of the portable monitor. Outside, the emergency lighting had been restored to standard. Someone had found the fault, or reset the relay, or the power interruption had simply run its course. The corridor went from red to white, and the sudden normality of it was almost disorienting. Nora's phone buzzed again. Not the unknown number this time. A text from a number she recognized as belonging to Marcus, the ER tech. It read, "There's a man down here asking about you. Not police, not admin. Told me he's from hospital legal. He's looking at the Bay 1 chart." She showed the agent the screen without comment. He read it. His jaw tightened slightly. "How many ways are there into this room?" "Door and window," she said. "Windows 30 feet up." "Stay here. He moved to the door. I'm not going to stay here, she said. He stopped, turned. He looked for the first time mildly exasperated, which was human and therefore slightly reassuring. You're a suspended nurse in a federal crime scene. I'm the only person in this building who can tell you if his treatment needs adjusting. She met his look. And I'm the only person who recognized what was used on him, which means I'm the only person who knows what the recovery curve actually looks like. A beat. You need me here. And I think you know that. He held her gaze for a moment longer than was comfortable. Then he stepped into the corridor and she followed him, because she had said she would, and because the alternative was standing alone in a room with a man whose unconscious survival was currently the most important variable in a situation that was rapidly becoming more complicated than an ER nurse in Hargrove Falls, Tennessee, should have any reason to be involved in. She had spent 6 years not being involved in anything like this. The corridor was different now. More populated, more tense, with the particular charge of a space where everyone was performing a role and nobody was quite certain what the others were actually doing. The agent moved toward the nursing station, and Nora stayed 2 steps behind him, and she was scanning the space with the automatic habit she'd spent years trying to quiet. Entry points, exit points, lines of sight, who was where and what their body language communicated about where they expected the threat to come from. The man from Hospital Legal was not in the ER. Marcus had sent 2 follow-up texts while she'd been in room 304. He left, went toward admin elevators, and then, 4 minutes later, Bay 1 chart is gone. Physical copy. Someone pulled it. She stopped walking. The agent, half a step ahead, noticed and turned. Someone pulled the Bay 1 chart, she said. The physical copy, which documented the compound presentation, the treatment protocol, and my initial assessment. She looked at him. That chart is the clinical record of what was done to him and what was used to do it. Without it, the toxicology panel is still in the system. The toxicology panel shows an unusual enzyme inhibition pattern. Without the clinical assessment documenting the specific presentation, the specific odor, the specific site characteristics, it's an anomalous lab result that any defense attorney worth the fee could argue was a contaminated sample or a pre-existing condition. She watched him understand this. Someone is clearing the evidence chain, she said. The agent was already on his phone, voice low and fast. She caught fragments. Chart removal, Bay 1, need camera footage, South Wing Administrative Corridor. Her phone rang. Unknown number, she answered. What? They know the chart is gone, the voice said. They're going to try to move him. Move Vane? Within the hour. They'll manufacture a medical transfer. Critical care center, better equipment, something procedurally defensible. Once he's in transport, he's unprotected. The device goes with him, and if the transport doesn't arrive at the stated destination, he stopped. You understand what I'm saying? She understood exactly what he was saying. I can't stop a medical transfer, she said. You can document the clinical reason why transport is contraindicated. A pause. In writing, signed, time-stamped, lodged in the system before the transfer order goes through. A patient on pralidoxime at this stage of a cholinergic toxidrome is not medically stable for transport. And you're the only clinician in that building who can articulate exactly why in terms specific enough to hold up against a falsified order. She was already moving toward the nurse's station. There's one problem, she said. I know, the voice said. You're suspended. I don't have access to the documentation system. A pause. Delia Marsh, senior ICU nurse. She has access and she was in that corridor when the dart hit the wall. Another pause. She saw enough. The call ended. Nora reached the nurse's station. Delia was there, clipboard in hand, and she looked up with the expression of someone who had been through a very long morning and was prepared for it to continue being very long. I need to use your system access, Nora said. Delia looked at her. I need to document clinical contraindication for patient transport on room 304, formally, time-stamped, before someone files a transfer order that's going to get that man killed. Delia was quiet for a moment. She looked down the corridor toward room 304. Then she looked at the nursing station computer. Then she looked at Nora. You're suspended, she said. Yes. If I log this under my credentials, I'm accountable for the documentation. Yes. And you're telling me a transfer order is coming that's manufactured. I'm telling you what I know, Nora said, which is that the patient in 304 is on active pralidoxime therapy for cholinergic toxidrome caused by an organophosphate compound, that he is clinically contraindicated for transport for a minimum of 6 hours given current enzyme inhibition reversal progress, and that I need you to document that in the system in the next, she checked the clock, 8 minutes, because that's my estimate of how long before a transfer order appears. Delia looked at the computer, at the clock, at Nora. Move, she said and sat down at the keyboard. They were 4 minutes into the documentation when the elevator at the end of the corridor opened and Richard Coyle stepped out, accompanied by a man in a suit Nora didn't recognize and one of the dark-jacketed agents she'd seen arriving earlier. Coyle's face when he saw her was the specific expression of a man encountering something he'd been assured was no longer a variable. She was removed from this building, he said, to anyone in range of his voice. I suspended her. Why is she still... She's consulting on patient care for room 304, the agent from the corridor said, from 3 feet behind Nora. She hadn't heard him come up. Under federal authorization as a medical expert relevant to an active investigation. She is a nurse on suspension, Mr. Coyle. The agent's voice was very calm. Why did you come up from the south stairwell? Coyle stopped. The south stairwell, the agent continued, which connects to the subbasement corridor, which is where a secondary asset fled approximately 20 minutes ago after attempting to discharge a pneumatic injection device at a federal officer in this corridor. The man in the suit beside Coyle took 1 step sideways, very slowly, in a direction that suggested he had suddenly reconsidered his proximity to Richard Coyle. I came up the south stairwell because the main elevator, Coyle started. Save it, the agent said. Not loudly, not dramatically, with the particular quiet authority of someone who had decided where this was going. Sir, I need you to come with me. And Richard Coyle, who had handed Nora her badge that morning with the satisfaction of a man exercising the small power available to him, went pale in the red-turned-white light of the ICU corridor and did not finish his sentence and did not resist when the agent took him by the elbow and walked him toward the elevator. Delia hit submit on the documentation. The timestamp read 11:47 a.m. Nora let out a slow breath, looked at the computer screen, at the formal clinical contraindication now lodged in the system under Delia's credentials, reference to the anomalous toxicology panel and the documented treatment protocol and every observable clinical indicator she could translate into the language of medical record-keeping. Done, Delia said. Thank you. Don't thank me yet. Delia stood up. You want to tell me what's actually happening here? Nora looked at her, at the honest question in her face, the specific exhaustion of someone who had decided to trust a thing without full information and was now wanting the information. A man in that room has the evidence to expose someone who's been compromising national security for 18 months, Nora said. And the people who want him dead are not all outside this building. Delia absorbed this. Was Coyle? I don't know. And she didn't. Not with certainty, not yet. Her phone rang again. Unknown number. The transfer order just went into the system, the voice said. Filed from a terminal in the administrative wing 2 minutes ago under a physician authorization code belonging to Dr. Warren Halstead. Nora looked at the corridor, at the elevator where the agent had taken Coyle, at room 304 where Garrett Vane breathed by mechanical rhythm and didn't know what was being done around him. Your contraindication documentation is in the system, the voice continued. They'll challenge it. They have a physician authorization, and you have a suspended nurse who used someone else's credentials. What do I do? She asked it flatly, without self-consciousness, because this was not the moment for self-consciousness. You get to Halstead, the voice said, right now, before he realizes his authorization code has been used without his knowledge. Because if someone used his code without telling him, he's either part of it or he's a target, she said. Find out which, the voice said. Fast. The elevator was 20 feet away. She was already moving toward it when the lights went out again. All of them, this time the entire 3rd floor. Not just emergency lighting, not just the ICU, everything going dark simultaneously in a way that was categorically different from the first power interruption. And in the sudden absolute black of the corridor, she heard the door to room 304 open. The door to room 304 opened in the dark, and Nora stopped moving and dropped below the corridor railing in the same instinctive motion, her back against the wall, and she could hear footsteps, 2 sets, not one, moving fast and low. And she could hear the ventilator alarm beginning its protest at a disconnected lead, the specific tone of a monitor losing signal. And she understood in the span of about 1 second that someone had used the power interruption as cover to get into that room, and that Garrett Vane, unconscious and intubated and incapable of protecting himself, was about to stop being a problem for whoever had put the compound in his arm. She did not have a weapon. She had a hospital corridor in the dark and the specific knowledge of what was in it. She moved by memory. 6 years of walking this floor during night shifts, power drills, the 2 actual outages she'd worked through. The crash cart was 12 feet to her left, against the wall between the elevator and room 302. She found it by touch, confirmed by the texture of the handle, and she was already moving before she'd completed the thought. The footsteps from room 304 were coming into the corridor now. She could hear one of them speaking, low, in a language that wasn't English, clipped and directive. And the second set of footsteps was heavier, moving with something. Someone. They were moving Vane. She pulled the crash cart into the corridor and shoved it hard toward the sound of the footsteps, and it hit something substantial, a person, not a wall. And the sound that followed was the particular involuntary noise a person makes when 200 pounds of medical equipment hits them in the dark at rolling speed. One set of footsteps went down. The other stopped. She was already moving laterally, toward the nursing station, because standing still in a dark corridor after announcing her position was how you stopped being a problem in a different and permanent way. "Who's there?" Not a question. The voice from the corridor, in English now, controlled but with an edge underneath it. She didn't answer. The emergency lighting came on, red again, and she was 3 feet from the nursing station, and the man on the floor was already pushing himself upright, medium build, the wrong length scrubs from earlier, which meant this was the secondary asset who'd been in sub-basement and hadn't actually left the building. And the second man was beside the gurney that held Garrett Vane, which they'd managed to move approximately 8 feet out of room 304 before the crash cart intervened. The second man looked at her. She looked at him. Damn. He was older. 50s. The jacket was right this time, dark and fitted, and he had the ID lanyard of the Federal Response Team around his neck, except the way he was standing next to an unconscious man he'd been attempting to move in the dark was not consistent with federal protective posture. "Step away from the gurney," she said. He did not step away from the gurney. The man from the floor was upright now, and she registered the pneumatic device in his right hand, the same type that had been used in the corridor earlier, and she was doing the math on her options, which were not abundant. The nursing station was behind her. The elevator was at the far end of the corridor. The stairwell was closer, but on the wrong side of the man with the device. "Ms. Voss," the man in the federal jacket said, and his voice was the trained calm of someone who'd been in rooms like this before, "you have misunderstood the situation." "Tell me how," she said. She needed him talking. Talking was time, and time was the agent from the corridor, who had been with Coyle in the elevator, who should be, if he was what he said he was, somewhere in this building. "The patient needs to be transferred to a secure facility. Transfers require attending physician authorization, and the attending physician's credentials were used without his knowledge to file that order." She kept her eyes on both of them, alternating the particular visual discipline of tracking 2 points simultaneously, which I know because the person who filed the order made that mistake. The man in the jacket paused, fractional, but she caught it. "You can't know that. I know it because Halstead wouldn't have authorized a transfer for a patient at this stage of cholinergic recovery. He's arrogant, not stupid. Anyone who actually spoke to him before using his code would have known that." She kept her voice even. "So whoever used his authorization didn't talk to him first, which means either Halstead is genuinely uninvolved or he's involved but wasn't trusted with the transfer plan, which tells you something about how much the people running this operation trust their own assets." She was watching his hands. The man from the floor was watching her, the pneumatic device at his side, not raised yet. "Move away from the patient," she said again, "both of you." "Or what?" the man in the jacket said. And it wasn't a challenge, exactly. It was a genuine question. A man assessing leverage, which meant he hadn't fully resolved what she was yet. The stairwell door behind him opened. The agent from the corridor came through it at a pace that wasn't quite running, but was everything below that, and he took in the scene in the time it took to cover 2 steps. The gurney, the man in the jacket, Nora at the nursing station, the secondary asset with the pneumatic device, and he had his weapon up and his voice out simultaneously in the way that people trained for this kind of entry. Did it when they'd done it enough times that it was architecture rather than decision. Federal agent, hands where I can see them, now. The secondary asset raised the pneumatic device. The agent shot it. Not the man, the device, in the man's hand, and the shot was close enough that the muzzle force knocked the asset backward 2 steps, and the device discharged into the ceiling tile above room 302, and the asset stood there with his hand shaking and the ruined device in it and the expression of someone reassessing all available options rapidly. Hands, the agent said. Quiet. Absolute. The asset put his hands up. The man in the federal jacket did not. He had moved, in the half-second of the shot, to the side of the gurney that put Vane between himself and the agent's weapon. Not behind him entirely. There wasn't room, but adjacent enough that the calculus was uncomfortable. Reyes, the man in the jacket said. The agent kept his weapon steady. Don't. You don't have the shot, and you know it. I also don't have a reason not to wait, the agent said. This building is surrounded. You've got 1 asset down in the corridor and 1 with his hands up. Your transport isn't coming because the exterior exits are sealed, and the parking lot has 4 additional federal vehicles that arrived while you were in sub-basement. He paused. You've run the math already. You know how this ends. The man in the jacket, Reyes apparently, which was not the name Nora would have associated with someone in a federal response jacket, was quiet for a moment. She watched his face in the red emergency light, watched him run the math as the agent had said. She had run it already too, and the agent was right about most of it, except for one variable he might not have identified yet. The man in the jacket still had his hand on Vane's IV line. She saw it when she shifted her angle slightly. The gloved left hand, the particular positioning of the fingers, the small pressure clamp he'd already moved into place. If he closed that clamp and opened the secondary port, she could see him holding with his index finger whatever was in the small reservoir he'd palmed would go directly into the IV line. She didn't know what it was. She knew it wasn't good. Agent, she said, her voice precise and flat. His left hand. The agent's eyes moved for a fraction of a second, and in that fraction, she was already crossing the corridor. She covered the 8 feet between the nursing station and the gurney in the specific way she moved when she was moving fast in a space with obstacles. Economical, no wasted momentum. And her left hand caught Reyes's left wrist, and her right hand went for the IV line above the secondary port, and she had the line pinched off above the port before the reservoir could open. And the angle of her body was between Reyes and the gurney, and she was close enough that the pneumatic device or any conventional weapon was more risk than utility to him. She looked him in the face from approximately 18 inches. He was 52, maybe 54. The face of someone who had been very certain about things for a long time. There was no panic in it, just the specific recalibration of a person deciding whether this was the moment. You put whatever's in that reservoir into his line, she said, and I will make sure the documentation of this compound's profile is on the desk of every toxicologist, every national security attorney, and every investigative journalist who covers DOD before your transport clears the city limits. She held his wrist. She was not strong enough to hold it indefinitely, and they both knew that. Is it worth it? He looked at her for 2 seconds. Then he released the reservoir. She took it from his hand without releasing her grip on the IV line, and she stepped back, and the agent was there. And Reyes went to the wall with the controlled inevitability of a man accepting a conclusion he'd already calculated. And Nora stood in the red corridor light with a small glass reservoir in her hand and her heart doing something irregular that she was going to have to address later, and the ventilator alarm still going from the disconnected lead. She went into room 304 and reconnected the lead. The monitor restabilized. Vane's pulse was 102, elevated from the disruption, the movement, the adrenaline response that happened at the autonomic level even in unconscious patients. She checked the IV line for integrity, confirmed the pralidoxime drip was uncompromised, checked the ventilator settings. She stood in the room for a moment with her back against the wall and breathed. Her hands were completely still. She looked at them, which was a thing she did sometimes to confirm that what she felt internally wasn't visible externally, because 6 years of trying to be only a nurse had not entirely quieted the training that made her hands stop shaking before the rest of her caught up. The agent appeared in the doorway. "You all right?" he said. "Check on Delia and the rest of the ICU staff." "I did. They're fine. They sheltered in the south wing the way you told them." He paused. "You told them to do that before the lights went out." "I thought it was a likely next step." "Why?" She turned to look at him. He was asking the question that had been underneath every exchange they'd had since he arrived in this building, and she was tired, and Garrett Vane was breathing, and Richard Coyle was somewhere in federal custody, and the man who called himself Reyes was in the corridor with his hands behind his back. "Because the first power interruption was targeted," she said. "ICU only, specific. That's a probe. You're checking response time. You're checking what the building's backup protocols look like. You're identifying gaps. The second one would be broader, because the probe told them what they needed to know." She looked at the monitor. "So I told Delia to move people before the second one came." The agent looked at her for a long moment. "I need to know who you are," he said. "I'm Nora Voss. I'm an ER nurse. I've worked at Mercy Cross for 6 years. Before 6 years ago." She looked at the floor, at the specific scuff pattern of hospital linoleum that she'd walked across thousands of times and never really looked at the way the emergency lighting caught the edge of the ventilator housing. "Before 6 years ago is a conversation that requires authorization I don't have, and neither do you," she said. "And it's not relevant to what's happening in this room right now." She looked up. "What is relevant is that Garrett Vane is alive. The transfer order needs to be challenged in the system, and there is a physician in this building whose authorization code was used without his knowledge who may or may not be a cooperating party." She paused. "Halstead." The agent nodded slowly. "We have him. He was in his office. He paused. "He's not involved. His code was pulled from the system by someone with administrative access." "Coyle," she said. "Coyle had administrative access, yes." She absorbed that. "Did Coyle talk?" "Not yet. He will," she said. Not out of confidence exactly. Out of the specific read she'd had on Richard Coyle since the morning. A man who exercised power in small spaces, who made decisions based on calculation rather than conviction. A man like that, when the space collapsed, didn't hold. She moved to the door. "I need to check Vane's enzyme levels. The portable monitor doesn't run a metabolic panel. Is there a lab tech who can draw from the room without going through the main system?" "I can arrange that." "Arrange it." She stopped. "And get someone to look at the reservoir I took off Reyes. Whatever's in it needs to be identified before anyone decides what charges are appropriate." "Already in process." She nodded. Stepped into the corridor. The secondary asset was zip-cuffed against the wall, 2 agents standing with him. Reyes was similarly secured, standing slightly straighter, with the expression of someone who had already decided not to say anything and was committed to that decision. Delia had returned from the south wing and was moving through the corridor with the clipboard, doing what needed doing, because patients didn't stop needing things, because the ICU had just been a partial crime scene. Nora watched Delia work for a moment. Then her phone buzzed, the unknown number. She answered, and before she could speak, Halstead's authorization code wasn't the only one used. She walked away from the nearest agent, toward the window at the end of the corridor. "What else?" "There's a second transfer order in the system, filed 40 seconds ago. Not for Vane." A pause. "For you." "For me." A psychiatric hold. 72 hours. Involuntary. Filed under the hospital's mental health protocol, using language consistent with a staff member exhibiting erratic behavior during a crisis. Unauthorized treatment, refusal to comply with suspension, presence in restricted areas while under administrative action. The voice was careful. Not rushed, but close to it. "The authorization on this one is a physician credential, psychiatry department." "Who?" "Dr. Annette Browd, chief of psychiatry." Nora didn't know Browd well. She knew her by sight. 50s, reserved, the particular professional distance of someone who'd spent a career hearing things people didn't say to anyone else. She'd had no direct interaction with her beyond hallway acknowledgments. Is Broad part of this? I don't know, the voice admitted. Her code could have been pulled the same way Halstead's was. Or she could be. He paused. What I know is that a psychiatric hold removes you from this building without requiring anyone to justify it to federal authority. It's a hospital administrative action, which means it takes precedence over the federal consultation authorization your agent gave you. She stood at the window. The parking lot below had 5 vehicles now, and she could see figures moving in a pattern that suggested expanding perimeter. Whatever was happening inside Mercy Cross Medical Center had attracted more federal attention in the last hour and a half than Hargrove Falls had probably seen in its entire institutional memory. How long before someone comes to execute the hold, she said. It's already been transmitted to hospital security. Which hospital security? The 2 officers on the second floor who aren't the ones in the ICU corridor. She turned from the window. The agent was 20 feet away, on his phone. She covered the distance quickly. Someone filed a psychiatric hold on me, she said without preamble. Transmitted to hospital security on the second floor. It's an administrative mechanism to remove me from the building outside your federal consultation authorization. He looked at her, processed this faster than she expected. Broad? Her code. Not necessarily her. He made a call. 1 sentence. Suspend all hospital administrative actions originating in the last 10 minutes. Federal override, active investigation. Paused. Because I said so. Hung up. That buys you 20 minutes, he said. After that, someone will challenge the override and it'll need to go up the chain. 20 minutes is enough. For what? For Halstead to look me in the face and tell me what he knows. She paused. He knows something. He's been in this hospital for 19 years. He doesn't make decisions based on anything except his own judgment, and someone used his code without his knowledge, which means someone had his system access, which means someone either stole his credentials or he gave them to someone voluntarily at some point and forgot what he was giving. She met the agent's look. He's not part of this, but he's a thread. The agent nodded once. I'll take you to him. They took the elevator to the second floor. The administrative corridor was different from the clinical spaces, carpeted in a way that absorbed sound and made the building feel like 2 different buildings sharing a structure. Halstead was in the 3rd conference room with 1 agent stationed outside and the door closed. The agent opened the door. Halstead sat at the conference table looking like a man who had aged several years in approximately 2 hours. He still had the chart in his hand, the chart she'd noted him carrying when he entered Bay 1, the one he'd set down when things had gotten complicated, apparently retrieved since. His face when he saw her was complex. Residual authority, conflicting with the particular chagrin of a man who knew he'd been wrong about something significant. Ms. Voss, he said. She sat down across from him. The agent stayed by the door. Your system credentials were used to file a patient transfer order for the man in room 304, she said. You didn't file that order. I know. His voice was different than it had been in Bay 1, quieter. They showed me. When did you last change your system password? He looked at his hands. 6 months ago, maybe 7. Who had access to your office terminal? It's a shared login for the credential system. The password isn't. It's stored in the system administrator's master access. Any administrator with root access can retrieve it. Coyle, she said. He said nothing, which was confirmation. He's in federal custody, she said. Did he ever ask you about your system access directly? Did he ever ask you to authorize anything unusual? He asked me. Halstead stopped. He set the chart down. 3 weeks ago, he asked me to review a patient transfer protocol for our critical care pathway, a scenario document. He said it was for accreditation. He rubbed the side of his jaw. The expression of a man reconstructing an event with new information. He needed my authorization signature on the document. I signed it. I didn't. It was a standard-looking accreditation form. He had your authorization signature on a document, she said, which a competent forger could. I know what it means, he said sharply. Then, more quietly, I know what it means. She looked at him. At the hands on the table, the chart that had been his prop and his armor all morning, now sitting between them like something neither of them needed anymore. The patient is alive, she said. He looked up. Vane, the man in Bay 1. He's in the ICU, he's stable, the pralidoxime is working, his enzyme levels should be recoverable. She kept her voice factual. He almost wasn't, but he is. Halstead was quiet for a moment, then, I was going to kill him. You were going to use a protocol that would have killed him. That's different from, I dismissed you, he said. I dismissed what you were saying. I've been dismissing you for, he stopped. You corrected a pediatric dosing error last month. Third floor peds, yes. And the sepsis call on the woman in Bay 7 in September. I know what that was, he said. I signed off on a treatment course that was 20 minutes from being too late, and you had flagged it in the chart notes 4 hours earlier, and I didn't read them. He looked at her steadily. Not with apology, exactly. Halstead was not built for apology, but with the specific honesty of a person who had decided to stop performing. You've been right more times in this building than I've given you credit for. She didn't respond. This was not what she'd come to the conference room for, and it wasn't something she'd needed from him for a while. The accreditation document you signed for Coyle, she said. Do you have a copy? My office. We need it. She looked at the agent. He nodded. She stood up. Halstead looked up at her, and she met his look without performing anything in either direction. For what it's worth, she said, the system would have called you back in that moment, in the trauma bay. You authorized the atropine. Eventually, he said. Eventually is still authorization. She moved toward the door. Miss Voss? His voice behind her was different again, not the chief physician voice, something below that. Whatever you were before this, whatever you knew that made you able to do what you did this morning. He paused. I'm glad you were in that bay. She kept walking. The corridor outside had changed. 2 additional agents she hadn't seen before were moving toward the administrative wing with a purposefulness that suggested new information, and she caught the edge of a radio transmission, fragmented, urgent, as she and the lead agent moved toward the elevator. What happened? She said. He listened to his earpiece. His jaw tightened. Reyes talked, he said. Already? Not voluntarily. He had a medical event, cardiac. They're treating him now, but before they got to him, The agent stopped, listened again. He said one name, and then he stopped talking. She waited. The name is Sutherland, he said. Deputy National Security Advisor, DOD Intelligence Liaison. He looked at her. He's been in contact with this investigation since the initial alert. He has access to Vane's case file, Vane's location protocols, the compound classification documents. He paused. He's the one who made the call that triggered the federal response to this hospital. She stood in the administrative corridor of Mercy Cross Medical Center and understood, with a particular cold clarity, the architecture of the last 4 hours. Sutherland had triggered the response. Sutherland had sent the team, including Reyes, who was on that team. Sutherland had access to everything, including the secondary assets positioning, the maintenance corridor layout, the compound's classified profile. Sutherland had constructed a response that looked like protection and was actually completion. He'd sent people to finish what the compound had started, inside the federal response itself, which was why the agent she was standing next to hadn't known about Reyes until Reyes had tried to use a pneumatic device in the corridor. And Sutherland was somewhere outside this building with full access to the ongoing situation. He knows Vane survived, she said. Yes. He knows the secondary asset and Reyes are in custody. Yes. He knows the transfer order failed. She looked at the agent. He's going to escalate. He doesn't have anything left to lose in this particular play, which means his next move isn't surgical. It's... The agent's radio erupted. Multiple voices. The particular compressed urgency of people who were trying to communicate and not managing it cleanly. She caught the fragments. North perimeter, vehicle, credentials, don't... And then shots fired, and then something she didn't catch. And then a single voice, clearer than the rest. Medical incoming, we need a bay cleared. We have a federal agent down. She was already moving toward the elevator, toward the emergency stairs, toward whatever was happening because a federal agent down meant trauma, and trauma meant... Voss? The agent caught her arm. You cannot go to the ER. Someone's coming in. My people will... Your people are not trauma nurses. She held his look. Let go of my arm. He held for one more second, then released. She took the stairs. The ER was 2 floors down, and she was through the stairwell door and into the department before she'd fully processed the decision, because decisions in this mode weren't sequential, they were parallel. Think and move simultaneously, assess and act in the same motion. The ER was controlled chaos, which was its normal state, but the quality of this chaos was different. 2 of the agents from the parking lot were inside, one of them bleeding from his left arm, and the paramedics from Unit 11 were coming through the ambulance bay with a gurney, and Reyes, the EMT, looking genuinely frightened, which she had not looked this morning. "What do you have?" Nora called. "GSW, chest, right lateral, entry and exit confirmed, no pneumothorax on presentation, but breath sounds are..." Reyes trailed off. "He's an agent. They brought him in from the north perimeter. Someone rammed the perimeter vehicle, and there was an exchange." "Bay 2, Nora said. Then she stopped. She had no badge. She had no authorization. She had been suspended by a man who was now in federal custody, and she was a nurse with no credentials standing in an ER she'd worked in for 6 years. Marcus was at the supply cart. He looked at her. "Gloves are in the drawer," he said. She pulled gloves. The agent on the gurney was mid-30s, the face of someone who was working very hard to stay conscious and failing incrementally. Right lateral chest wound, as reported. She confirmed the exit on initial roll, slightly larger than the entry, which was consistent with the trajectory, and the breath sounds on the right were reduced but not absent, which meant she had time but not much. Pneumothorax developing rather than present, which was the difference between a chest tube in the next 8 minutes and a chest tube right now. "I need a chest tray," she said. She looked at the ER physician who'd arrived at the bay. Not Halstead, a younger attending named Park, who she'd worked with on nights. "Developing tension pneumo, right side, we need to..." "I see it," Park said. He looked at her for exactly 1 second. The suspended nurse, the chaos outside, the federal agents in his ER, and then looked at the patient. Chest tray. Marcus was already moving. She worked. She focused on the work with the totality that the work required and did not allow any other variable to enter her field of attention. And Park worked beside her with the particular quality of a physician who was competent and knew it without needing to announce it. And together they stabilized the chest in 11 minutes, which was not fast by textbook standards, but was fast by real-world standards, in an understaffed ER on a Tuesday morning with the hospital 3/4 locked down. The agent's oxygen saturation came up. His color improved. His breathing stopped sounding like something tearing. She stepped back. Her hands had a faint tremor now. Not from fear, but from the adrenaline finally having nowhere to go. She pressed them flat against the cart for a moment and breathed. "Good call on the timeline," Park said quietly, to no one in particular. He was updating the chart. If he'd waited another 5 minutes... "Didn't," she said. She stripped her gloves, turned. The lead agent was in the bay doorway. He looked at the stabilized patient, then at her. "Sutherland," she said. "We have confirmation he initiated the vehicle. Remote directive, not direct presence. He's not in Hargrove Falls." "Where is he?" "D.C. 40 minutes ago he was at a briefing at the Pentagon, which means he has an alibi for everything that happened here this morning, and he's been running it all through cutouts." She said it without surprise. "The secondary asset, Reyes, Coyle, none of them can directly implicate him unless there's a documented communication chain." "Vane has it," the agent said. "Vane is unconscious." Vane built an off-network documentation file, 60 days of sequestered evidence. The file has a time-release protocol. If Vane doesn't enter his access code within 72 hours of its last reset, it transmits automatically to 3 secure external repositories. He paused. The last reset was yesterday morning. She did the math. 71 hours. Yes. Which means even if Sutherland... She stopped, looked at the agent. "Does Sutherland know about the time release?" "Unknown. If he doesn't, he'll keep trying to get to Vane. If he does..." She worked through it. "If he does, he doesn't need Vane dead anymore. He needs the file. He needs to get into the 3 repositories before the transmission window, and he has 71 hours to do it, and he has the system access that Vane didn't know he had when he built the protocol." The agent was very still. "Can Sutherland access those repositories?" she said. "2 of them, potentially. The 3rd is encrypted with a key that only Vane has." Then Sutherland needs Vane conscious, she said. Not dead, conscious, accessible, and cooperative. She looked at the agent. Which means the threat profile just changed. He's not sending people to kill Vane anymore. He's sending people to extract him. The agent made a call before she finished the sentence. She leaned against the bay wall and looked at the ceiling of Mercy Cross Medical Center's ER, at the fluorescent light above Bay 2 that had been flickering for 4 months, and that she'd submitted 2 maintenance requests about, and that was still flickering. And she thought about Garrett Vane upstairs breathing by mechanical rhythm, and the 71-hour window, and Sutherland in Washington with a Pentagon alibi and full system access, and the unknown voice on the phone that had called her 3 times and still hadn't told her who it was. And then Marcus appeared at the bay opening. "There's someone at the employee entrance," he said. "He has military ID. He says—" Marcus looked uncertain. "He says he's here for Voss, specifically. He said to tell you—" He looked at the card in his hand. "He said to tell you the code word is Lingate." The fluorescent light flickered. She looked at Marcus, at the card, at the word written on it in handwriting she recognized, from a time before 6 years ago, from a man she had last seen when she signed the paperwork that was supposed to end all of this. She straightened. "Tell him to come in," she said. The man who walked through the employee entrance was not what Marcus had been expecting, judging by the look on his face when he stepped aside to let him pass. The military ID was real. She'd seen enough of them to know the difference. And the man carrying it was 61, lean in the particular way of someone who had been physically disciplined for decades and hadn't stopped, with close-cropped gray hair and the kind of face that had been weathered into something that read as authority without trying to. Brigadier General Thomas Aldrich. She hadn't seen him in 6 years, 2 months, and approximately 11 days, though she hadn't been counting the days exactly. She'd just been aware of them. He walked into Bay 2 and looked at her, and his expression was the expression of someone who had been monitoring a situation from a distance and had decided the distance was no longer appropriate. Not warm, exactly. Aldrich was not a man who led with warmth, but something in it was, she didn't have a better word, relieved. "Voss," he said. "General, you look tired. I've had a morning." He looked at the stabilized agent on the gurney, at Park, who was updating the chart and pointedly not making eye contact with a brigadier general who had appeared in his ER without warning, at the lead agent, who had gone very still in the way that people went still when a ranking they hadn't anticipated walked into a room. "Who's your federal lead?" Aldrich said to Nora. "That would be me," the agent said. "Special Agent Dorian Walsh, DoD Criminal Investigative Service." Walsh. Aldrich didn't extend his hand. He looked at the man with the specific assessment of someone calibrating how much to say and to whom. "How long have you been running this response?" "Since 0900. "Who authorized your deployment?" Walsh paused. Deputy Director Sutherland triggered the initial alert. "I know he did," Aldrich said. "That's why I'm here." He looked at Nora. "How's Vane?" "Stable. Pralidoxime running. He'll be conscious in 3 to 5 hours if the recovery curve holds." She looked at him steadily. "You've been watching this?" "Since approximately 47 minutes before Unit 11 called it in," he said. "We had surveillance on Vane's movement protocol, saw it separately from the primary investigation, separately from anything Sutherland's office had access to. When the alert hit at Keller Street, I was in Nashville." He paused. "I called you." She looked at him. "The unknown number," she said. "Prepaid, routed through 2 relays." He said it without apology. "I needed you in that building, and I needed you to stay in it, and I didn't know yet which of the federal responders were clean." She absorbed this. "You've known where I was for 3 years." "Yes." "You said you'd leave me alone." "I said I'd leave you alone unless the situation changed." He held her gaze. The situation changed. Walsh was watching this exchange with the expression of a man piecing together a picture he hadn't known was incomplete. He looked at Aldrich. "You ran a parallel surveillance operation on a DoD official without coordinating with CIS." "I ran an operation that wasn't connected to anything Sutherland could see," Aldrich said. "Because 18 months ago I started suspecting that someone with Sutherland's access was the source of the breach, and the only way to build a case that couldn't be compromised was to keep it entirely outside the channels he monitored." He paused. Vane was running the official investigation. I was running the insurance policy. The insurance policy being Nora, Walsh said. Aldrich looked at her. The insurance policy being the only person in the country who would recognize what was used on Vane and know what to do about it, who happened to be working in the city where Vane's cover itinerary placed him this week. She felt something cold move through her that had nothing to do with temperature. My placement here, she said carefully. 6 years ago. Was that? Your placement was legitimate, he said. You left the program, you relocated, you built a life. I didn't arrange that. A pause. But when Vane's task force brought him through Hargrove Falls 6 weeks ago as part of his cover rotation, and I cross-referenced the city with people I trusted who were already in it, your name was there. He said it simply. I didn't manufacture the coincidence, I used it. She turned that over for a long moment. She thought about the 6 years, the shifts, the patience, the specific texture of a life that was hers in every particular, the regulars in the ER she knew by name, the route she drove to work, the apartment with the kitchen window she'd never quite gotten around to hanging curtains in. She thought about how carefully she'd maintained the boundary between what she was and what she'd been, and how completely this morning had collapsed it, and whether she was angry at Aldrich for being the reason, or whether she'd known, somewhere below the 6 years of ordinary life, that the boundary was always provisional. We need to move, she said. Sutherland knows the extraction attempts failed. He has 71 hours before Vane's time release transmits, and 2 of the 3 repositories are potentially accessible to him. 70 hours now, Walsh said, checking his watch. He'll go for the repositories, Aldrich said. He can't reach Vane without coming through this building, and this building is currently... He doesn't have to reach Vane, Nora said. Both men looked at her. Vane's access code, she said. The encryption key for the 3rd repository. Sutherland doesn't have it, but Vane didn't build that protocol in isolation. There are people who supported the technical infrastructure, the developer who built the time release system, the secure server operators. If Sutherland can identify who built it and apply the right kind of pressure before the transmission window, he could pull the key from the source, Walsh said, or corrupt the transmission, she said. Delay it. Alter the destination. There are a dozen ways to neutralize a time release file if you know the architecture and you have 70 hours and the access level to move through federal systems without triggering an alert. She paused. Who built Vane's documentation system? Walsh and Aldrich looked at each other, the kind of look that communicated an inconvenient answer. A contractor, Walsh said. Small firm, DoD cleared, brought in for secure file architecture. The contract went through Sutherland's office. The room was very quiet for a moment. So Sutherland authorized the contract, Nora said. He knows the contractor. He knows the architecture. She looked at Aldrich. Can you reach the contractor before Sutherland does? I have someone working it, Aldrich said. He looked at Walsh. I need your authorization to bring my team into this building formally. What's been running here this morning has been a coordination problem. Your people operating with incomplete information because the alert came through a compromised source. I need to consolidate the command structure under a clean authority, and I need to do it in the next 20 minutes. Walsh looked at him for a long moment. Aldrich was a brigadier general and Walsh was a special agent, and the hierarchy was clear, but the situation had layers that hierarchy didn't automatically resolve, and Walsh was not a stupid man. Your parallel operation, Walsh said. If it wasn't coordinated with CIS, it also wasn't authorized through standard channels. No, Aldrich said. Which means if this goes to tribunal, the chain of custody on your surveillance, Walsh. Aldrich said his name with the flat patience of a man who had been navigating institutional constraints for 3 decades. Vane has 60 days of documented evidence sequestered on an off-network device that a man with a classified organophosphate compound tried to prevent from reaching a tribunal. The chain of custody on Vane's documentation is clean. What I've been running separately gets us to the tribunal. Vane's file wins it. He paused. Do you want Sutherland, or do you want to spend the next 40 minutes arguing authorization? Walsh exhaled through his nose. It was not an elegant concession, but it was a concession. He made a call. Nora left them to it and went upstairs. The ICU had been transformed in the 40 minutes she'd been in the ER. Aldrich's people, 4 of them, in a combination of plain clothes and actual military bearing that was more visible than they probably intended, had taken positions at the corridor's key points. Delia was at the nursing station with the expression of someone who had stopped being surprised by things and was simply managing them. Two of Walsh's agents were in the corridor, now operating with the slightly recalibrated posture of people who understood the command structure had shifted. She went to room 304. Vane had been repositioned. Someone had adjusted the pillow angle, which was correct for his drainage posture, and the drip was running at the rate she'd set. The portable monitor showed pulse at 88, which was improved, and the oxygen saturation at 96, which was good. The skin color was better. The fasciculations were gone and had not returned. She checked the enzyme levels that the lab tech had drawn while she was in the ER. The acetylcholinesterase activity was rising, slowly but consistently. The pralidoxime was doing its job. The recovery curve was going to be on the longer end because of the specific compound variant, but it was going to be a recovery curve. She pulled a chair to the side of the bed and sat down. She hadn't sat down since she arrived at the hospital at 6:47 that morning. It was now past 1 in the afternoon. She had been awake for 9 hours, running on the particular fuel of crisis attention, and the chair was a temporary concession to the fact that her body existed independently of her intentions. She looked at Garrett Vane. He looked unconscious and intubated, like any patient looked in that state, reduced to the essential machinery of existence, breath, and pulse, and the slow chemical work of metabolism. He didn't look like a man who'd been carrying 60 days of classified evidence through a covert itinerary in Tennessee. He didn't look like the person on whom the exposure of an 18-month intelligence breach apparently depended. He looked tired, even unconscious. The lines of his face held something that was recognizable as exhaustion. She understood that. "Your documentation better be as good as advertised," she said, to no one in particular. To the room, to the specific category of person who built something this important and then got themselves poisoned before they could use it. His pulse ticked steadily on the monitor. 88. 89. She stood up. Aldrich was in the corridor when she came out, and beside him was a man she didn't recognize, mid-40s in civilian clothes that were too well fitted to be accidental, carrying a tablet that he shifted to his left hand when she approached, as if making his right available. She didn't take the offered hand. "This is Reeves," Aldrich said. "He's been running the technical surveillance on Sutherland's system access." "The contractor," she said to Reeves. "Did you reach them?" 40 minutes ago, Reeves said. He had the voice of someone who thought faster than he spoke, which made the measured pace of his delivery its own kind of information. "The contracting firm is a 3-person operation out of Reston. They built Vane's secure file architecture 14 months ago. Sutherland's office was the authorizing client, but the technical specifications came directly from Vane, and Vane built in a secondary encryption layer that the contracting firm wasn't given access to. So Sutherland can't get the key from the contractor," she said. "He can't get the key, but he could, potentially, get the transmission pathway architecture, the routing for the time release. If he knows the routing, he can intercept the transmission before it reaches the repositories, which doesn't give him the file contents but prevents the evidence chain from landing where Vane intended. Can he do that in 70 hours? He could do it in 12, Reeves said, if he still has system access. A pause. Which is why we need to pull his clearance now, not at the end of the process. You need probable cause to pull a Deputy National Security Advisor's clearance, Walsh said, from behind her. He'd come upstairs without her noticing. Which we have in accumulation, but which needs to be formally assembled and presented to the appropriate authority, and that process takes longer than 12 hours, she said. In normal circumstances, Walsh said. But the circumstances have changed in the last 40 minutes. He held out his tablet. On the screen was a document, formal federal header, the specific typography of official authorization, and at the bottom a signature she recognized from years of seeing it on program documentation, the Deputy Attorney General. Emergency clearance suspension, Walsh said. Granted 11 minutes ago, Sutherland's access has been revoked across all federal systems as of 12:43 p.m. Eastern. He looked at Aldrich. The parallel surveillance you've been running, the documentation you've accumulated on Sutherland's communication pattern over the last 18 months, it's been submitted to the same authority and accepted as supporting evidence for the suspension. A pause. Informally. Aldrich received this with the stillness of a man who is accustomed to winning things without celebrating them. His access is revoked, Nora said, but he's still in Washington. Federal marshals are at his office, Walsh said. His personal counsel was notified 40 minutes ago. He's not going anywhere. She looked at the tablet, at the timestamp on the suspension order, at the reality of what the morning had produced. A man who had spent 18 months moving classified assets through channels he controlled, who had put a classified compound into a federal official's bloodstream to prevent his exposure, who had positioned agents inside a federal response to finish the job, who had constructed an alibi at the Pentagon while people acting on his instructions tried to kill an unconscious man in an ICU in Hargrove Falls, Tennessee. And that man's access to every system he'd been exploiting was gone, revoked by emergency order while he sat in his office with his clearance badge on his desk, probably still calculating. He doesn't know yet, she said. He will in approximately... Walsh checked his watch. 4 minutes. She thought about what Sutherland would do when he found out. A man like that, the architecture of his thinking, the way he'd layered cutouts and deniability and alibi. The moment his access was gone, the moment the walls started moving, the instinct would be to burn what he could and run toward what he couldn't be tied to. The contractor, she said to Reeves, the 3-person firm in Reston. He was already on his phone. She didn't have to finish the sentence. He'd thought of it too, which was why he was already on the phone, and she could hear him speaking in the rapid, exact language of someone issuing protective instructions to people who needed to move quickly. She went back to the window at the end of the corridor. Hargrove Falls looked ordinary from here. The north parking lot with the federal vehicles, the street beyond it, the line of commercial buildings along the far side, a dry cleaner, a pharmacy, an insurance office. The city that didn't appear in travel guides, that sat at the edge of a river nobody painted anymore. The city where she'd built 6 years of a life that was real and hers and sufficient in all the ways she'd needed it to be. She thought about the employee entrance this morning, the clipboard, the thermos, the 13 minutes early. Aldrich appeared beside her. They stood at the window for a moment without speaking. That was something she'd always found particular to him, the capacity to occupy a silence without filling it, which made the silences between them more communicative than most people's conversations. The program, she said. Yes. It wasn't terminated. He was quiet. 4 years ago, they told me it was terminated, she said. That was part of the exit. The program was done, the work was archived, and everyone who'd been part of it went back to whatever they'd been before or whatever came next. She paused. But the compound that was used on Vane, that wasn't in an archive. Someone synthesized it. Recently, given the inhibition profile. The metabolite degradation pattern was current synthesis, not stored stock. There's a remnant program, Aldrich said. Smaller, different authorization chain. I've known about it for 14 months. And the compound ended up in Sutherland's operational capability. He had access to the remnant program through his liaison role. He recognized what it could do, and he used it. Aldrich looked out the window. Which is part of what Vane's documentation covers. The remnant program, she said. Is it being shut down now? That decision goes higher than me. He said it honestly, which she appreciated. But the exposure of how the compound was obtained and used this morning, that makes the continuation very difficult to justify. Very difficult isn't the same as impossible. No, he said, it isn't. She looked at the street below, at the ordinary city going about its ordinary Tuesday. When Vane wakes up, he'll need to enter his access code within the window. After that, the file transmits and the evidence chain is complete. Aldrich turned from the window. At that point, the case against Sutherland is no longer dependent on anything that happened here this morning. But this morning's events are still evidence. Everything that happened here is documented and preserved, he said, including the compound identification, including the treatment record, including what you did in Bay 1, and what you did in that corridor, and what you did with the reservoir. He paused. It's all documented, Nora. Your name is on all of it. She understood what he was telling her. Her name was on the documented identification of a classified compound, which meant her name was attached to the knowledge that classified compound represented, which meant the file she had spent 6 years trying not to have was about to be considerably more visible than it had been at 6:47 this morning. What does that mean for my personnel file, she said. It means the section of your personnel file that currently reads as 7 years of uncategorized employment history will be supplemented, Aldrich said. Not made public, but accessible to the appropriate authorization levels and consistent with what happened here. So I can't be a nurse at Mercy Cross Medical Center anymore. He was quiet for a moment. I didn't say that. You didn't have to. He turned to look at her. What you did here this morning, the identification, the treatment, the tactical management of an active threat in a non-tactical environment, that's documented in a federal record that will carry significant weight in a significant proceeding. The decision about what comes next for you is not mine to make, and it's not being made today. He paused. But I didn't put you in this position to take something from you. I know, she said. And she did know. That wasn't the anger she felt. The anger she felt was more specific and less addressable. The anger of someone who'd built something careful and watched it become irrevocably larger than they'd built it to be. I know that. Her phone buzzed. Walsh, from 20 feet down the corridor. She turned. His face, when he looked up from his own phone, had the quality of something arriving that he'd been waiting for, but hadn't expected to feel quite so much about when it did. Sutherland tried to access 3 federal systems in the 4 minutes after his clearance was revoked, Walsh said. The access attempts are all logged, time-stamped, origin confirmed from his office terminal. His counsel advised him not to attempt any system access, and he attempted it anyway. He paused. Every attempt is logged as unauthorized access on federal systems under active investigation. His counsel has been notified. The federal marshals in his office have taken possession of his devices. No. He panicked, Nora said. He did exactly what someone does when they run the math and realize the walls have closed. Walsh looked at the tablet. The access attempts include one to the DoD System Architecture Database, which is where the routing information for Vane's file transmission would be stored. He looked up. He was trying to get to the routing. And the log of that attempt is now evidence that he knew the file existed, knew its architecture, and attempted to compromise it, she said. Yes. While his counsel was telling him not to touch anything. Yes. She thought about the specific self-destruction of a man who had controlled information for 18 months, suddenly losing the ability to access any of it and reaching for the systems anyway. The particular human failure of a person who had been very certain for a very long time doing the thing that very certain people did when certainty ran out. They grabbed. Walsh was speaking again. Reyes, from the ICU corridor. He had a cardiac event. We told you that. He's stable now, and when he stabilized, his first request was for a federal attorney. He wants to deal, Aldrich said. He wants to deal, Walsh confirmed. His attorneys have been in contact with the prosecutor's office for the last 40 minutes. What he's offering is a documented communication chain between himself and Sutherland's office going back 11 months, including the operational directive for what happened here today. He paused. Delivered through a secondary channel that Sutherland believed was clean. It wasn't clean, Nora said. Reyes kept copies, Walsh said. He said he kept them for exactly this situation. The situation where Sutherland left him in the field to be arrested. She looked at the tablet in Walsh's hand. At the accumulation of what the morning had built, the compound documentation, the treatment record, Aldrich's surveillance, the access attempt logs, Coyle's administrative trail, the physical evidence from the corridor in room 304, and now Reyes's communication archive. Sutherland had spent 18 months building a structure designed to be invisible and deniable, and it had collapsed in approximately 4 hours because he'd tried to use a classified compound on a man in a city where the one person who would recognize it happened to be working a Tuesday morning shift. She didn't find this satisfying in the way she'd thought she might, if she'd ever imagined it. It was just complete. A thing that had needed to happen, happening. I need to go check on Vane, she said. She walked down the corridor. Behind her, Walsh and Aldrich were talking in the low procedural tones of men managing the aftermath of something large. Delia looked up from the nursing station as she passed. His BP's been climbing steadily, Delia said. 98 over 62 20 minutes ago. Good. She stopped. How are you doing? Delia considered the question with the seriousness it deserved. I've had better Tuesdays. Me too. She went into room 304. The pulse on the monitor was 92. The oxygen saturation was 97. She checked the pralidoxime drip. confirmed the rate, checked the secondary IV line for integrity. She stood at the bedside and ran the standard neurological check. Pupillary response, corneal reflex, and both were improved from the last assessment. His fingers moved, small, uncoordinated, the involuntary movement of someone surfacing through sedation rather than directed action. But movement. She watched his hand and then his face, the micro-expressions of someone whose nervous system was beginning to reassert itself against the compound's suppression. His eyes opened. Not fully. Halfway. The particular unfocused gaze of someone who was conscious but not yet assembled, who had awareness without context, which was its own kind of disorientation. He looked at the ceiling, at the IV line, at the ventilator tubing. She moved into his field of vision. "Mr. Vane," she said, calm, unhurried. The voice she used for patients coming out of sedation, which required a specific quality, present, grounding, without pressure. "You're at Mercy Cross Medical Center in Hargrove Falls, Tennessee. You're safe. You've been on ventilatory support, but your numbers are good, and we're going to start the wean process." He looked at her, not the unfocused gaze of a moment ago. Something was assembling behind his eyes, slow, working against the residual effect of the compound, but present. His hand moved again. Deliberate this time. He was trying to reach the ventilator tubing. "Not yet," she said. "I need you to tolerate that for a little longer. When your breathing effort is strong enough, we'll remove it. Right now, I need you to squeeze my hand." She put her hand in his. He squeezed. Not strongly, but intentionally. "Good," she said. He looked at her for a long moment. His mouth couldn't form words around the tubing, but his face was doing something, working through what it was assembling. She watched his expression shift, the disorientation of a man understanding where he was, and from that, beginning to understand what that meant. His eyes moved to the IV line, to the portable monitor, to the door, then back to her. She saw the moment he understood she was not a threat, the specific release of the particular vigilance that people carried even unconscious when they'd been what he'd been. The vigilance that persisted below consciousness because it had been conditioned there, the same way the compound had activated pathways that bypassed his conscious control. She recognized that vigilance. She knew what it felt like to carry it. "The file is safe," she said quietly. "Your access code is going to be needed, but not yet. Not until you're extubated and oriented and you've been assessed. There's time." His hand, still in hers, tightened fractionally. She stayed in the room while Walsh arranged for the ICU attending to initiate the ventilator wean, a process that would take time because Vane's respiratory effort needed to be confirmed independent and sustained before anyone removed the tube. She stayed through the first stage of the wean, and then she stepped out because Delia and the attending didn't need her in the room and the corridor needed her more. Aldrich was waiting outside. "Sutherland's been formally arrested," he said. "His office, 40 minutes ago. He was apparently on the phone with his personal attorney when the marshals came in." He paused. His attorney advised him not to say anything. He said something anyway. "What did he say?" "He asked how they found out." Aldrich said it without inflection. Not denial. Not protest. He asked how. She looked at the corridor, at Delia at the nursing station, at Walsh's agents at the elevator, at the specific configuration of a space that had been a standard hospital ICU at 10 o'clock this morning, and had become something else entirely, and was now in the slow process of becoming a hospital ICU again. "Someone will answer that question eventually," she said, "in a tribunal." "Yes," Aldrich said. "They will." She was quiet for a moment, then, "What happens to Coyle?" "He's been cooperative since Walsh's people put him in the conference room. He was recruited by Sutherland's office 8 months ago. Minimal direct involvement, primarily access provision. His counsel is already negotiating the terms." He paused. "He won't walk, but he won't carry what Sutherland carries." She thought about the badge she'd placed in Coyle's palm that morning, the particular satisfaction on his face. "And Halstead?" "Not involved," Aldrich said. "Cleared, formally, as of an hour ago." A pause. "He's been asking about you." She looked at him. "Not officially," Aldrich said. "He asked Walsh's agent in the conference room. He wanted to know if you were all right." She didn't have a response to that. It was too small a thing to carry the weight of the morning and too human a thing to dismiss. She walked back to the window at the end of the corridor. Below, one of the federal vehicles was leaving the parking lot. The perimeter was beginning to contract, the crisis's acute phase resolved, the remaining work shifting to documentation and process, and the long, careful machinery of prosecution. Hargrove Falls was still there. The river and the half-renovated downtown and the pharmacy and the insurance office on the far side of the parking lot, ordinary and completely unchanged. Her phone buzzed. Unknown number. She looked at it, then looked at Aldrich. "You can stop using the prepaid," she said. He reached into his pocket. The buzzing stopped. She looked at the screen. One text from the number she now knew was his. "You should know. What you did today will be in the classified record for 20 years. After that, it'll be public." She read it twice. Put her phone away. 20 years. She'd be in her mid-50s, still a nurse probably, somewhere, still arriving 13 minutes early. She turned from the window to go back to work because Garrett Vane was extubating in the next hour, and someone needed to be there, and the federal record and the 20-year clock could wait while she did what she was actually here to do. She was 3 steps down the corridor when Walsh appeared from the elevator with the expression of a man carrying information he hadn't expected. "We have a problem," he said. She stopped. "The third repository?" Walsh said. "Vane's encrypted file, the time release protocol." He held up the tablet. Reyes, in his cooperation debrief, disclosed something he hadn't mentioned in his initial communication archive offer. He looked at her steadily. Sutherland didn't just have access to the transmission routing. He had a technical team working on the third repository encryption for the last 3 weeks. They didn't break it. The encryption held. But they introduced a code modification in the transmission protocol that Vane doesn't know about. That's it. She waited. "When Vane enters his access code," Walsh said, "the modification routes the file to one additional destination before the 3 intended repositories, a destination Sutherland controls." He paused. "Or controlled before his arrest. The destination is still live. His technical team is still active. And his arrest doesn't automatically deactivate a system modification they introduced 3 weeks ago." He looked at her. "Vane has to enter the code, because if he doesn't, the file wipes in 69 hours. But if he does enter it, the first copy of his 60 days of evidence goes to a server that Sutherland's people still have access to." She looked at Walsh, at the tablet, at the specific shape of the trap that had been sitting in the architecture of this entire day, waiting under everything else, patient as the compound that had been patient in Vane's bloodstream. "Can the modification be found and reversed?" she said. "Our technical team is looking at it now," Walsh said, "but it's layered under standard protocol code and it was introduced by someone with expert-level access and significant lead time." He paused. "We don't know how long it'll take. And we have 69 hours. Minus however long it takes Vane to become lucid enough to be informed of the situation and decide what to do," Walsh said. "Yes." She stood in the corridor with the ventilator wean proceeding in room 304 and Garrett Vane slowly assembling himself back into a person who could make decisions, and 69 hours on a clock, and a trap buried in the code of the thing the trap was meant to protect. She looked at Aldrich. He was already looking at her. "Reeves," she said. "On it," he said, and he was already on the phone. Reeves worked for 4 hours and 19 minutes without leaving the chair they'd pulled into the ICU family consultation room, which had been converted into a temporary technical operations space with 2 laptops, a secure satellite connection routed through Aldrich's team, and 3 empty coffee cups that Marcus had quietly provided without being asked. Nora checked on him twice. Both times he was in the specific posture of someone who had gone so far into a technical problem that the physical world had become a minor inconvenience. Back curved, face close to the screen, fingers moving in short, precise bursts followed by long stillnesses. She didn't ask for updates. If there was something to report, he would report it. She spent those 4 hours and 19 minutes doing what the situation required, which was hospital work, because the hospital had not stopped needing things while a technical team tried to dismantle a trap buried in federal file architecture. The agent with the chest wound needed his dressing changed and his saturation monitored. Two of the ICU patients who'd been moved during the chaos needed reassessment. Delia had been on shift for 10 hours and needed someone to cover while she ate something. And Nora covered the station because the federal record and the technical problem and what came next could wait while she did the work that was in front of her. Garrett Vane was extubated at 3:47 in the afternoon. It took 40 minutes of respiratory effort assessment, 2 failed readiness checks that she called accurately and the ICU attending confirmed, and then a third check at 3:44 that cleared. And she was in the room when they removed the tube. He coughed, which was normal and looked worse than it was. And then he breathed on his own with the slightly labored quality of someone whose respiratory musculature had been suppressed for hours and was rebuilding its rhythm from scratch. He looked at the ceiling. He looked at the IV line. He looked at her. "You're the nurse from this morning," he said. His voice was rough, diminished, the vocal cords irritated from the tube. "Yes." "You argued with someone?" "Yes." "About me?" "About the treatment protocol, technically." She checked his oxygen saturation. 96 on room air, which was good. "How are you feeling?" He considered this with the seriousness of a man who understood the question had clinical relevance rather than social function. "Like someone turned my nervous system off and back on. My hands are numb. Residual effect. It'll resolve over the next 12 to 18 hours. The sensation will come back incrementally. Tingling first, then normal feeling. Don't try to grip anything tightly until the ICU attending clears you." She noted the reading on the clipboard. "Your blood pressure is stable, your enzyme levels are recovering, and your cognitive function appears intact." She paused. Can you tell me the current date?" He told her the date. He told her the day of the week. He told her the name of the President, the Secretary of Defense, and with a slight edge that she interpreted as the man beginning to reassemble himself, the name of the Deputy National Security Advisor, which he delivered with an expression that was not warm. "Sutherland," he said. "Under arrest as of approximately 2 p.m., she said. "His clearance was revoked, his devices are in federal custody, and Reyes has been cooperating with the prosecutor's office since this afternoon." He absorbed this. The expression on his face wasn't the relief she might have expected. It was something more complex. The face of someone who had been carrying a thing for a long time and was only now setting it down enough to feel the weight of what carrying it had cost. "The file," he said. "There's a situation with the file," she said, "that you need to be briefed on by Agent Walsh when you're ready." "Not yet." She met his look when he started to object. "You've been unconscious for 7 hours after a cholinergic poisoning that put your heart rate at 30 beats per minute. You have another 15 minutes before Walsh comes in here. Use them." He looked at her for a moment. "What's your name?" he said. "Voss." "What kind of nurse were you before you were a nurse?" She looked at the oxygen saturation monitor, the kind that's not in your file. He was quiet for a moment. "Thank you," he said. Not the automatic thank you of a patient to clinical staff, the specific weighted version, a man who understood exactly what he was thanking someone for. She nodded once, then she went to get Walsh. Walsh briefed Vane in 11 minutes, with Aldrich present and Reeves patched in through a secure audio connection. She stood in the corridor and let them do it because her presence wasn't necessary for that conversation, and there was a particular clarity in knowing when a thing required you and when it didn't. Reeves's voice came through the door at one point, louder than his usual register. "If we can identify the injection point in the routing layer, we can excise it and revalidate the transmission pathway before he enters the code." A pause. "I just need the transmission architecture document." Then Vane's voice, rougher but present. "I have it memorized. I'll dictate it." She stopped listening and went back to the nursing station. Delia was there. It was past 4 in the afternoon, and the ICU had been something close to a federal operation site for 6 hours. And Delia had the look of someone who had exceeded the reasonable threshold of any shift and was continuing on the particular fuel of professional stubbornness. "Go home," Nora said. "My relief doesn't come in until 7. "I'll cover." Delia looked at her. "You're suspended. Coyle suspended me. Coyle is in federal custody. The administrative action is currently, in the words of Agent Walsh, under review pending the investigation." She kept her voice level. No one has actually told me to leave this building today, except a man who used hospital resources to facilitate an assassination attempt on a federal official. So, Delia looked at her for a long moment. Then she stood up, retrieved her bag from beneath the desk, and put her jacket on. She stopped at the end of the nursing station. Bay 3 patient needs a reassessment at 5:15, she said. He's been stable, but his family is going to call, and they always call twice and hang up the first time, so when the phone rings, wait for the second call. Got it. And the monitor in 307 has a lead that shifts when the patient moves. It'll alarm and it's not real. You have to go in and reseat it manually. I know, Nora said. I submitted a maintenance request. Twice, Delia said. Twice, Nora confirmed. Delia almost smiled. It didn't quite form, but it was close. Then she walked to the elevator and left, and Nora sat down at the nursing station and did the work. Reeves found the injection point in the routing code at 6:23 p.m. He came out of the consultation room with his laptop and the look of someone who had been in a sustained technical confrontation and had won it by attrition rather than elegance, which was sometimes how these things went. It's a conditional redirect, he said to Nora and Aldrich and Walsh, who had gathered in the corridor while Vane rested. Sutherland's technical team embedded it as a subroutine that activates only when the access code triggers the primary transmission. It's designed to look like a standard routing step, the kind of thing that exists in the legitimate architecture. You'd only find it if you knew it was there and knew exactly what you were looking for. But you found it, Aldrich said. Vane knew his own architecture well enough to walk me through the legitimate routing layer from memory. Reeves looked at the laptop screen. Once I had the baseline, the anomaly was visible. I've excised it and revalidated the pathway. The transmission will go to the 3 intended repositories and nowhere else. Walsh let out a breath. It was the first time she'd seen him express anything that wasn't controlled professionalism, and it lasted for approximately 2 seconds. How long to confirm the excision is clean, he said. It's clean, Reeves said. I've run the verification 3 times. Walsh looked at Aldrich. Something passed between them, a decision being made through the particular shorthand of 2 people who had been in enough situations to communicate in compressed form. We need Vane to enter the code, Walsh said, tonight, before anything else changes. She went into room 304 and told Vane he was needed. He said he understood. He sat up in the bed with the deliberate care of someone managing a body that was not yet fully his again, and she helped him adjust the angle because his arms were still not reliable, and she didn't make it into anything more than what it was, a nurse adjusting a patient's position, which she'd done 10,000 times. He entered the access code into the device Walsh brought to the bedside at 6:51 p.m. The transmission initiated. It was not dramatic. There was no indicator on the screen beyond a small progress bar that moved from left to right over approximately 90 seconds, and then a confirmation code. And then the screen went blank because the file had transmitted and the device's purpose was complete. Walsh photographed the confirmation code. Reeves logged the timestamp. Aldrich stood at the foot of the bed and said nothing. Vane looked at the blank screen for a moment. It's done, he said. It's done, Walsh confirmed. Vane leaned back against the pillow. He closed his eyes. Not in distress. In the specific release of someone who had been holding something for 60 days through cover itineraries and surveillance and an assassination attempt and 7 hours of unconsciousness, and was now, finally, empty-handed in the way that meant the thing had landed where it was supposed to land. She checked his vitals. Normal range across all indicators. His hands, when she took his pulse at the wrist, still had the residual numbness. She could feel it in the way he registered the pressure, slightly delayed. But his grip when he closed his fingers around her hand briefly was stronger than it had been an hour ago. Get some sleep, she said. Your body has a lot of work to do tonight. He nodded. His eyes were already closing. She went back to the nursing station. The next hour was the quietest the building had been all day. Federal personnel were still present, but in reduced number. The acute situation resolved, the remaining work transferred to the machinery of federal prosecution. The ICU returned incrementally to its function. Patients needed things. Monitors needed checking. The phone rang once from the family of the Bay 3 patient, and she waited through the hang-up and answered on the second call and told them what they needed to hear in the specific language of clinical reassurance that was honest and complete without being more than they could hold. At 8:15, Walsh came to the nursing station. The files reached all 3 repositories, he said. Verified receipt confirmed 40 minutes ago. The evidence chain is complete and secure. He paused. The legal team started on the formal charges against Sutherland at 6 p.m. We're looking at conspiracy to commit murder of a federal official, unauthorized access to classified systems, intelligence trafficking, and several charges under statutes I won't bore you with. He put a document on the counter. Coyle accepted a cooperation agreement. He'll face charges for his administrative role, unauthorized access provision, obstruction, but his sentence will be reduced for the cooperation. The hospital board has been notified that his suspension of your employment is voided as of today, pending a formal reinstatement review. She looked at the document, at the formal language of a thing being undone. The asset who was in the corridor with the pneumatic device, she said. The man in the wrong scrubs. In federal custody. His real name isn't the one on the ID he was carrying. Sutherland's office recruited him through a contractor chain that goes back 9 months. Walsh paused. He's also cooperating. Everyone's cooperating, she said. Sutherland isn't, Walsh said. His attorney has been very clear. He's not offering anything, he's not acknowledging anything, and he's prepared to contest every charge. He said it without inflection. That's his right. And the evidence chain from Vane's file, combined with what Reyes is offering, and the access attempt logs, and the physical evidence from this building, is thorough enough that his attorney's position is largely a professional courtesy at this point. She thought about Sutherland in his office at the moment the marshals arrived. The phone call with his attorney. The question he'd asked, how did they find out? Which was the question of a man who understood that the structure had fallen but couldn't see where the foundation crack had been. The foundation crack had been a Tuesday morning in Hargrove Falls, Tennessee. A man found under a bridge. An ER nurse 13 minutes early. At 9 o'clock, Aldrich appeared at the nursing station with a folder. Sit down, he said. She looked at him. Please, he added, which from Aldrich was notable. She sat. He put the folder on the counter and opened it. Inside was a document she recognized by format, the specific header and classification marking of an official personnel record. Her name at the top. Below that, 2 columns of employment history, the 6 years at Mercy Cross Medical Center, itemized, and beside it the 7 years before that, which had previously been listed as a single uncategorized block. The block was no longer uncategorized. She looked at the specific job titles and operational designations that had been blank in her file for 6 years, now populated with the accurate record of what she had actually done and where she had actually done it. Classified still. The document itself was marked accordingly, but present. Correct. A file that told the truth about what she was. This was authorized this afternoon, Aldrich said, at the same level as the suspension order against Sutherland. She looked at the document for a long time. There was a thing that happened sometimes, she'd noticed, when a correction arrived after a long time. The correction didn't feel the way you'd expected it to feel when you were waiting for it. It didn't feel like triumph. It felt like something quieter and less clean. Like the specific recognition that the years in between the wrong thing and the right thing had been real years, with real weight, and the correction didn't undo them so much as it simply told the truth about them at last. She thought about 6 years of being dismissed, 6 years of catching errors quietly, correcting charts without announcement, making calls that were right, and absorbing the credit going elsewhere because drawing attention was the thing she'd been most careful not to do. She thought about the September sepsis case, and the pediatric dosing error and 10,000 small moments of being precisely right in a building where her precision was structurally invisible. The reinstatement review, she said, will clear in your favor, Aldrich said, formally, publicly, within the hospital's administrative record. I know. She looked at the document. That's not what I'm thinking about. He waited. I'm thinking about whether I want to be reinstated, she said. He was quiet. He had the intelligence not to fill that silence. She looked at the nursing station, at the monitor in 307 that she'd need to reseat manually when the patient shifted, at the family waiting room at the end of the corridor where people sat in the specific configuration of people who were afraid and had no useful action to take, at the elevator where Delia had walked out 4 hours ago with her jacket and her bag and the muscle memory of a career spent in this building. She had built something here, something that had worked, that was real, that mattered in the specific and daily way that things mattered, when they involved people who were sick and frightened and needed someone to be competent and present and unafraid. She had not been pretending to be that person for 6 years. She had been that person. The other thing she also was didn't cancel it. It had this morning run alongside it. The two things that she was, working in the same direction at the same time in Trauma Bay 1. I want the reinstatement, she said, and I want it documented correctly. It will be. I want it documented that I was suspended without cause by an administrator acting in furtherance of a federal conspiracy, and that the clinical actions I took in Bay 1 were consistent with established toxicological protocol and saved the patient's life, and that I am a nurse of 6 years standing at this institution whose record is clear. She looked at him. Not a former operative who happens to work here. A nurse whose record is clear. Aldrich looked at her for a long moment. Something in his face, old and careful and genuinely, if not demonstrably, fond of her in the specific way of people who respected things they couldn't fully explain. That's what the document says, he told her. She nodded. She closed the folder and handed it back to him, because it was a classified document and not hers to keep. And then she stood up and went to check on the patient in 307 because the monitor alarm had started its complaint about the repositioned lead. She reseated it manually. The alarm stopped. She documented it. Then she went to check on Vane. He was awake, not fully alert, somewhere between rest and wakefulness, the specific borderland of a body performing the metabolic work of recovery. His color was better. His breathing was easy and unassisted. The numbness in his hands was receding. She could tell from the way he'd repositioned himself, a small adjustment that required fine motor control he wouldn't have had an hour ago. He looked at her when she came in. I've been thinking, he said, about how this morning was supposed to go. Were you supposed to be in Hargrove Falls? I was here as part of a cover rotation. Safe city, low profile, 1 day of administrative work done remotely, move on. He looked at the ceiling. I stopped at a food truck on Keller Street at 9:45. I was standing in line. I didn't feel anything. The delivery device was pressurized, she said. Pneumatic, small bore. You wouldn't have felt the injection at the site. I remember dropping my coffee. He was quiet for a moment. And then I don't remember anything until about an hour ago. That's normal for the compound. The compound, he said. You knew what it was. I recognized the presentation. He looked at her. Not pushing, just holding the door open. I worked in a program that used it, she said. In testing, controlled conditions. I was part of the team that documented the antidote protocol. She paused. The program was supposed to have been terminated. The compound was supposed to be archived. Sutherland had access to the remnant program, Vane said. It's in the documentation. One of the first things I found, 14 months ago, an unauthorized synthesis request approved through a back channel by someone with his clearance level. I didn't have the name yet. I spent 13 more months getting the name. She thought about that. 13 months of building a case against a man who had been watching the investigation the entire time. 13 months of knowing the water was compromised and being unable to tell anyone for fear that telling them would confirm to the thing watching the water that he'd been seen. She thought about what it cost to carry something like that for 13 months and still get it to the right place. Your file is secure, she said. All 3 repositories confirmed receipt. The evidence chain is complete. He exhaled, long and slow. I keep thinking, he said, about what would have happened if you hadn't been in that bay. Someone else would have been. Someone else who would have pushed epinephrine. She didn't answer because they both knew what the answer was. I don't believe in coincidence as a general principle, he said, but I'm going to make an exception for the fact that the one person in this city who knew what was in my bloodstream happened to be working a Tuesday morning shift. It wasn't entirely coincidence, she said, but it was partly. He looked at her. The partly matters, she said. The partly is what makes it true instead of arranged. He was quiet for a moment. What happens to you now? I go back to work, she said. Reinstatement is being processed. I'll be on the floor tomorrow if the administrative review clears, which it will. Just back to work. Yes. He looked at her with the specific expression of a person who was adjusting an expectation that had been formed without full information. That's not nothing, he said finally. What you do here? I know, she said. And she did know. She had known it for 6 years. She hadn't needed Garrett Vane to confirm it. though there was something specific and human in hearing it said plainly by someone who'd had reason to form an opinion. She checked his IV line, confirmed the rate, noted the clinical indicators on the clipboard. "Sleep," she said. "You have a long week of debriefings ahead of you." "I know." He looked at the window, at the dark of the November evening beyond it. "Thank you, Nora Voss." She looked at him. He'd used her name, her actual name, not the rank or the title, just the name, the way people use names when they meant something specific by them. "Get some rest," she said. She went back to the nursing station and worked until the night shift came on at 11. The night shift nurse was a man named Torres, who she'd worked alongside for 3 years, and who arrived to find his floor partially staffed by federal agents. The family consultation room converted to a technical operations space, and a set of documentation in the system that would take him 20 minutes to parse. He stood at the nursing station with the overnight report in his hand and looked at her. "Should I ask?" he said. "The summary is in the system," she said. "The federal personnel will be cleared from the floor by morning. Bay 3 patient needs reassessment at midnight. 307's monitor lead will alarm when the patient shifts. Reseat it manually. I've submitted 2 maintenance requests that haven't been actioned yet. Room 304 is a priority patient. Check his SAT and BP every 45 minutes through the night, and if his hands are still numb by morning, tell the attending." "Okay," Torres said. "Okay," she said, and handed him the clipboard. She took the elevator down to the ER level. The department was in its late-night configuration, quieter, differently staffed, the particular atmosphere of a space that had been through something and was now working through the ordinary end of an extraordinary day. Marcus was at the supply cart. He looked up when she came in. "You're still here," he said. "Just leaving." He looked at her for a moment. "Are you coming back?" "Tomorrow," she said, "if the paperwork clears." He nodded. He had the expression of someone who wanted to say something and was deciding whether to. He decided to. "You were right this morning," he said. "In Bay 1. I should have backed you up earlier." She looked at him. He was 24 years old and had been put in a position where the authority in the room was wrong and the person without authority was right, and he hadn't known what to do with that, which was a deeply human problem. "You got the atropine when I needed it," she said. "That mattered." He nodded. Something settled in his face. She walked out through the employee entrance and into the November night, and Hargrove Falls was cold and still and smelled like the river in the season, and she stood in the parking lot for a moment in the specific way she sometimes stood in the parking lot after long shifts, not quite ready to move, not reluctant, just present in the space between the work and the rest of it. Her phone buzzed. "Walsh," she answered. "I wanted to let you know directly," he said. "The formal charges against Sutherland were filed at 10:15 tonight. 17 counts across 5 statutes. The prosecutor's office is calling it the most documented case of its type they've received in 20 years. A pause. Reyes's communication archive covers 11 months of operational directives. Combined with the access attempt logs in Vane's file and what we recovered from this building today, he stopped. He's not walking away from this. She thought about Sutherland in an interrogation room somewhere in Washington, probably still not saying anything, his attorney beside him, the walls very close. "Good," she said. "The hospital board was formally notified this evening," Walsh continued. "They've been advised that the suspension of your employment was enacted by a hospital administrator whose actions are part of an active federal investigation, and that the clinical decisions you made today were validated by federal medical review as consistent with established toxicological protocol." A pause. "The board's counsel called our office. They're moving quickly." "I know," she said. "Aldrich told me." "Right." A pause. "Ms. Voss, what you did today was my job," she said. A moment of silence. "Some of it," he said. "Yes, some of it was considerably more than that." She looked at the sky above the parking lot. November in Tennessee, no stars through the cloud cover, just the ambient light of a city going about its night. "Walsh," she said. "The agent with the chest wound. Bay 2. Stable. He'll be in the hospital another 3 days, but he's going to be fine." "Good," she said. She ended the call. She stood in the parking lot for another moment and thought about the morning. About 6:47, and the thermos, and the 13 minutes early. About Pamela's face at the intake desk. About the smell in Trauma Bay 1 that had been the beginning of everything. The specific oxidized metallic signature that had come from a part of her she'd been careful not to think about, activated by a man who dropped his coffee at a food truck on Keller Street and couldn't remember anything after. She thought about what the morning had cost and what it had produced, and whether those two things were proportionate, and decided that proportionality was not the useful frame. The useful frame was simply what happened and what it meant. What happened was that a man came through her trauma bay, and she knew what was wrong with him, and she did something about it, and the something she did mattered, and the mattering rippled outward in ways that would take months and possibly years to fully resolve into the shape of consequence. What it meant was something she'd have to work out over time. That was how meaning worked. It wasn't available immediately, it accreted. It came from living with a thing long enough to understand it from multiple angles. She knew some things already. She knew that 6 years of being careful and quiet and invisible had not made her smaller. It had made her precisely calibrated. The invisibility she'd maintained was not loss. It had been a choice, and choices made carefully over time accumulated into something that looked like character when the moment required it. She knew that the things you were, all of them, not just the ones that fit the frame you'd built, didn't disappear because you decided not to use them. They waited. They came when they were needed, and being needed didn't have to be catastrophic to be real. She knew that the most consequential thing she'd done in 6 years at Mercy Cross Medical Center was not the classified antidote or the tactical management of an ICU breach or the identification of a federal conspiracy. It was the 4 minutes she'd spent sitting beside the drunk man in Bay 3 talking about nothing, which had convinced him to leave his IV in. It was the dosing flag on the pediatric chart. It was the sepsis call in September that she'd put in the chart notes 4 hours before anyone else arrived at the same conclusion. All of it mattered. The whole thing. The nurse and the other thing she was. You didn't have to choose which one was real. She put her phone in her pocket and walked to her car. She drove home through Hargrove Falls, past the river that nobody painted, past the half-renovated downtown, through the quiet streets that led to her apartment with the kitchen window she'd never hung curtains in. She made tea. She sat at the table and let the quiet be quiet for a while. Tomorrow she would go back. Not because she had to. Her reinstatement was pending, technically, the paperwork not yet finalized. No one could compel her. She would go back because it was Tuesday night, and she worked Wednesdays, and there were patients in that building who needed someone to catch the things that the protocols missed, and the monitors couldn't read and the charts didn't capture. She was that person. She had always been that person. She had just, for a long time, needed no one else to know it. The tea went cold. She drank it anyway and looked at the window where the curtains weren't. And outside, the November dark was just dark, ordinary, and sufficient. The city going on the way cities did. Indifferent to what had happened inside one building on one Tuesday, carrying its ordinary weight forward into the next ordinary day. There was something in that she found. Not comforting exactly, but true. The world didn't mark the moments when a person held. It didn't ceremony the times when someone knew the right thing and did it anyway, quietly, against resistance, without anyone watching who mattered. Those moments were their own record. They lived in the body that had made them and in the people who were still alive because of them. And that was enough. It had to be enough. For most people, most of the time, it was. The women and men who held when they were told to step back, who stayed when they were told to leave, who knew when everyone around them didn't, who carried their competence without requiring it to be seen. They were everywhere. In every hospital, every institution, every ordinary building where something extraordinary was required of someone who looked, from the outside, like nothing more than what their badge said. They saved the lives that history didn't bother to record. And then they went home and drank cold tea in kitchens without curtains and came back the next morning because the work was still there, and so were they. Nora Voss rinsed her cup, set it on the drying rack exactly where she always set it, and went to bed.